Make way for Mr. Speaker.
I invite the member for Kelowna Lake Country to lead the House in prayer or reflection.
Mr. Speaker, as we commence proceedings today in this Assembly, we ask for divine guidance so that our words and deeds may bring to all people of this great province hope, health, prosperity, and a vision for the future. May the deliberations in this chamber be characterized by temperance, understanding, and reason, to the end that we may better serve those who have made the members of this House guardians of and trustees for all the citizens of British Columbia. Amen.
Introductions by members. Madam Clerk.
Introduction of bills.
Attorney General.
Mr. Speaker, I have the honor to present a message from Her Honor the Lieutenant Governor.
Her Honor, the Lieutenant Governor transmits herewith Bill number 11, and Teachhold Miscellaneous Statutes Amendment Act 2021, and recommends the same to the Legislative Assembly. Attorney General.
Thank you, Honourable Speaker. I move the bill be introduced and read a first time now. Mr. Speaker, I'm pleased to introduce Bill 11, the Miscellaneous Statutes Amendment Act 2021. This bill amends the following statutes: the Clean Energy Act, the COVID-19 Related Measures Act, the Family Law Act, and the Motor Vehicle Act. I will be pleased to elaborate on the nature of these amendments during second reading of the bill. Thank you, Honourable Speaker.
Members, you heard the question. This is the first reading of the bill. Those who are participating remotely, have your voting cards ready, please. All those in favor indicate aye. Aye. Those who oppose indicate nay. Motion carried. Attorney General.
Thank you, Honourable Speaker. I move the bill be placed on the orders of the day for second reading at the next sitting of the House after today.
Again, members, you heard the motion. All those in favor indicate aye. Aye. Those who oppose, motion carried. Madam Clerk.
Statements by members.
Members, before I recognize the next member to make a statement, I want to remind all members to make sure there are no prompts. You know, when you're props when you're standing up, it's absolutely unacceptable. Otherwise, you will be confined to your room for the rest of the week. Member for Nelson Creston.
Thank you very much, Speaker. Today, I want to talk about growing in the Kootenays. Community Futures Central Kootenay, which has been in operation since 1985, is a nonprofit community economic development organization. They have supported people-developed businesses that have become staples here in the Kootenays. Their vision for a vibrant, diverse, and sustainable Kootenay economy that retains its local businesses and creates opportunities for them to start up and expand. With that in mind, Community Futures has been at the forefront of growing the emerging economy for the Kootenays through the Cannabis Business Transition Initiative. This program is a free business advising service available to residents of the Central Kootenay region. Through this program, it has replaced the predatory consultants that had descended on our region upon legalization. The Cannabis Business Transition Initiative, which is the first of its kind in Canada, is funded by the Ministry of Social Development and Poverty Reduction. The Kootenay region is recognized internationally for growing high-quality cannabis. This success is rooted in the large pool of skilled, knowledgeable workers. The Cannabis Business Transition Initiative advises with zoning and development, site design, security, good production practices, handling and storage, analytical testing, processing, distribution and retail, taxation, and recall processes. Community Futures also supports cultivators once they have received their license to ensure they're able to meet all the ongoing reporting requirements. To date, they have supported 11 cultivators transition, and they have 53 businesses in the process and have connected with more than 400 local cultivators. This program has been incredibly important in our region, and experienced cultivators from across the province have reached out to see if they could receive the expertise and support of this program. The program is helping to keep the talent, expertise, jobs, and small businesses in the Kootenays and increase tax revenue for our province so we can deliver more services to support people. To end, I would like to thank the incredible Cannabis Business Transition Initiative team, Shannon, Stacy, Paul, and Andrea, as well as the participants for your vision, your incredible work for our local economic development and the emerging regulated cannabis industry and economy here in the Kootenays. Thank you, Speaker.
Members, again, to remind, these are 2-minute statements. Member for Kelowna Mission.
Thank you, Honourable Speaker. I rise today in recognition of International Nurses Day and celebrate the dedication and service of nurses. May 12th is chosen as this day as it was Florence Nightingale's birthday. broadly acknowledged and revered as the pioneer of modern nursing. Florence Nightingale once said, and I quote, "Rather 10 times I would die in the surf, heralding the way to a new world, than stand idly on the shore," end quote. As a woman of action, she chose to step away from the prestige of her family's status and instead chose to become a nurse, serving her community and ultimately her country. Nurses today know the difficulty and sacrifice of stepping away from their families to serve their communities, finding new ways and new worlds of bringing about better health outcomes. Quote, "How very little can be done under the spirit of fear," end quote. Nightingale may have used these words while serving in the Crimean War, but we know that nurses have used this very spirit in the last year of the war against COVID, while still fighting wars on all of the other health concerns of our society. Our nurses arrive with vigor, courage, and compassion, as they know that very little can be done under the spirit of fear. But Nightingale made the path easier for others. War, outbreaks, education. Nightingale's mission was to improve the systems in which she served by saying, quote, "Were there none who are discontented with what they have, the world would never reach anything better," end quote. To all the nurses serving today, you make us better in all ways, and we thank you today for all of your courage, your innovation, your sacrifice, and your service. Florence Nightingale would be proud. Thank you.
Member for North Vancouver Seymour.
Thank you, Mr. Speaker, and thank you, the former person speaking, because that was well said about Florence Nightingale. I'd like to speak also about Nursing Day. Take my mask off. I would like to also speak about International Nursing Day in the context of nursing leaders. I'd like to talk about my friend Joanne, who works at Lionsgate Hospital. And when COVID started, she and her unit became the COVID unit immediately. They stepped up, they said, yes, we can do this. We will be the unit that takes it on first to try and find out what we're supposed to do and how we're supposed to do it. Immediately, transitions occurred. There was new training, there was new renovations, there was new equipment. And I don't know if you know how to work as a nurse. However, when they're doing renovations, it's extraordinarily difficult. People had to learn about ventilators. We had to have change rooms. We had to have phones outside so we could talk to the staff inside. There were instructions. There was how do we support our staff and clinicians. Every day, people were taught how to don and doff personal protective equipment because it had to be done properly. What they were doing also was they were supporting clients through the unknown journey of COVID with its abrupt crashes and gradual progressions to stability and its deaths. They supported families through limited visits, their fears, their anger, their despair, the unacceptable loss that they faced. If something needed to be done, she got it done, even if it wasn't in her job description. If they were short-staffed, she was at the bedside, ensuring patient care. She saw efficiencies that were to be had, they got done. As an advocate who was needed, she was there, or she found somebody to do what needed to be done. There was a professional woodwind player, woodwind player musician, who ended up coming in from ICU. He thought his life was completely changed. He would never be able to play his instrument again. Joanne got him a recorder so that he could start when his lungs were strong enough to start making music again. And as time went by, we went from very simple tunes to very complex tunes. Then she realized that COVID sufferers, oh, I'm out of time. Joanne calls herself the COVID queen with a laugh. I call her a professional, compassionate, knowledgeable, and effective nursing leader who inspires all those she interacts with to do the very best they can, as always. Thank you, Mr. Speaker.
Member for Richmond North Centre.
Thank you, Mr. Speaker. I rise in the House today to speak about Anti-Racism Awareness Week. Although Anti-Racism Awareness Week will not take place until May 23rd, I want to take this moment to recognize the initiatives from the many members from both sides of the House, as well as our incredible community leaders and advocates who have helped bring this to fruition. It has been less than 2 months since we gathered at the Vancouver Art Gallery for the Stop Asian Hate rally. But the momentum that the public has built in that time is helping draw public awareness to this critical issue and is driving our actions for change. I would like to thank the more than 11,000 British Columbians and Canadians and the more than 170 community and cultural organizations who have signed and supported our petition to declare an Anti-Racism Education Day. Last week, over 100 participants joined the town hall on ending racism. The attendees include members from the Punjabi, Jewish, Chinese, Black, and Southeast Asian communities. They share their stories of being racialized at workplaces and even on the streets. I was glad to see government take many of the ideas we brought forward in our Anti-Racism Education Day petition and letter, because education is the greatest tool we have to fight ignorance and hate. Anti-Racism Awareness Week will help people learn how to practice identifying, challenging, preventing, and eliminating hate, as well as changing the values, structures, policies, programs, practices, and behaviors that perpetuate racism in our province. So I hope this first Anti-Racism Awareness Week will be the first of an annual tradition that we can embrace for generations to come, as well as the first of many initiatives that we can undertake together to eliminate all forms of racism and intolerance in our province. Thank you.
Member for Surrey Cloverdale.
Thank you, Mr. Speaker. When most of us think of chat, we think of the little box at the bottom of a Zoom call. To me, chat is a Clayton Heights activity team. Pre-COVID-19, chat was a weekly support program at Clayton Hall for at-risk youth. Chat provides activities, a safe place to spend some time, and opportunities to build relationships with caring adults, providing mentoring and peer-to-peer support. Chat was formed as a pilot project in 2013 and was included in the City of Surrey Public Safety Strategy in 2017 to support at-risk youth who were disengaged, disconnected, and did not respond well to other forms of programming. Jen Temple started the youth group to help her tenants who were complaining about teens loitering and causing havoc around the Hillcrest Village Shopping Center in Clayton. Instead of just hanging out in the parking lot, Jen was able to get them to come to the Clayton Hall with a simple promise of dinner. Each week, Jen would cook dinner and talk and plan activities such as screen printing, ICVC distracted driving, and other ideas. By doing this, Jen was able to reach them on their level, on their terms. As a city councillor, I was invited to chat with them and show them how to make their own pasta from scratch. The look on their faces of those who ate that fresh fettuccine was an experience I'll never forget. They couldn't believe how easy it was to make and how good it tasted. During the pandemic, they used their Instagram chat account to connect with the youth and check in. By doing so, they've been able to reach out and let them know that they're still here and they still care. Before I close, Mr. Speaker, I must share an amazing chat success story. Chloe, who struggled with school and got herself into a bit of trouble, lacked confidence and needed somebody in her corner. Over the first year of chat, she opened up and chat was able to connect her with some services. I'm happy to tell the House today that recently, Jen wrote a reference letter for Chloe to enter the early childhood education program at Douglas College. Sometimes in life, you just need people in your corner. Chat is that corner, and Jen and the volunteers are the supports to all of those corners. Thank you, Mr. Speaker.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. It's a pleasure to stand in the House today and talk about an incredible employer in my riding, Highland Valley Copper, during Mining Week. I want to share with you how important mining is in my area. When I was 6 years old, just a few years ago, my dad got a job at Bethlehem Copper, located near Ashcroft. The mining valley is located very close to Logan Lake and is rich with minerals. Next, Lornex Mine opened. The two properties merged, and what we have is a very solid employer with long-term, good-paying jobs for people who live in the area. When we moved to Ashcroft, as a family with 6 kids, the mine offered building lots to mine employees for $5,000. It enabled employees to build their homes affordably. They also provided townhouses and apartments for rent. Ah, the good old days. Young people stepped right out of high school into good-paying labor jobs and were offered opportunities to apprentice and build skills. The opportunities at the mine opened the doors to future engineers, technicians, first aid attendants, mechanics, plumbers, electricians, to name but a few. Highland Valley Copper has been very supportive of community projects. They have recognized and partnered with local First Nations. During Mining Week, I wanted to talk about how this property has been so much more than just extracting minerals out of the ground. They are innovative, ahead of their time, providing employment opportunities for long-term jobs. Our communities benefit from people who have worked at the mine for sometimes 40 years or more. They are our volunteers, our coaches, our leaders. To Highland Valley Copper and everyone who works there, you make us proud to celebrate Mining Week. Thank you, Mr. Speaker.
Thank you, member, for finishing your statement within 2 minutes. Madam Clerk.
Oral questions by members.
Leader of the Official Opposition.
Well, thank you, Mr. Speaker. Yesterday we heard, and I quote, "The fruit and vegetable program is something that has been very valuable and that many schools in many parts of British Columbia depend on," end quote. That was the Minister of Agriculture yesterday, as she unbelievably confirmed that the NDP have killed the program. In a pandemic, as families struggle, the Premier decided to end a successful program that has been running for over 15 years, and instead apparently spent that money on spin doctors for his office. This is what a teacher in New Hazelton has to say, and I quote, "It's hard to learn when you're hungry, and our students are better able to concentrate and learn when their tummy is not the principal issue on their minds," end quote. So will the Premier today do the right thing and reinstate funding for this absolutely important program that his minister was so rightly proud of yesterday? Will he do that immediately?
Minister of Agriculture.
Thank you, Mr. Speaker, and thank you to the official opposition for bringing this topic up again. It's a great day when agriculture makes its way into the legislative chamber. I would like to say that we are really proud of that program. It does a lot of great work. In British Columbia, we have over 300 land and sea-based products, and I'm happy to say some of that gets distributed around the province into the school system for kids to try vegetables and fruit for the very first time sometimes, and also to make sure that they develop healthy eating habits for the future. I have to say that the request for the funding came in this year, and the association had provided 2 options for funding. That had to be looked at in the context of the implications that the pandemic has had on the program. And I am happy to say that the consideration is, it's under active consideration by the Minister of Health. But I have often expressed my support for this program, and I know the Minister of Health also supports it. I think we should have some news soon.
Leader of the Official Opposition on a supplemental.
Well, thank you very much. And while I'm sure that British Columbians are happy to hear the Minister of Agriculture supports a fantastic program like this, what they want to hear from the Minister of Agriculture is a yes, and that the money's going to get out the door since it's already past the deadline. Yesterday, the minister said in her glowing reviews, "We will be looking at ways to support this type of program," end quote. So it seems pretty clear that the Premier doesn't intend to keep the existing program. This is a program run in British Columbia by 4,000 volunteers. It has the support of teachers and parents across constituencies, including Stikeen. Let me share this quote with the Premier. The Gatineau School is heavily in support of the BC School Fruit and Vegetable Nutritional Program, and we hope to see it fully funded for years to come, end quote. Well, instead of funding vegetables for students, the Premier gave his office a $4 million raise, which is more than the cost of this program. So yesterday, the minister implied that there would be discussion, and today she confirmed that. It is time for the minister to stop with the glowing recommendations and actually do something. Pretty straightforward. Say yes, reinstate the funding for the program, and do it today. Will the Premier stand up and do that today?
Minister of Agriculture.
Thank you, Mr. Speaker, and thanks again for the enthusiastic question. It's hard not to be glowing about products that get grown in our province and distributed in every region, including into the school system. As I said, there is currently, they are analyzing the request. But I did say that we're looking at ways of supporting many programs. This is just one program that is run by volunteers that brings the topic of agriculture right into the heart of classrooms. They're all run by incredible volunteers like teachers and parents and students. And so as we look at this request, we're also considering other programs that we can take on. I'm really excited to be able to have the opportunity to work with the Minister of Education as we look at other options as well. So as I said, it's under active consideration, and I think we'll have some good news soon.
Member for Abbotsford West.
Well, thanks, Honourable Speaker. The Minister conveniently overlooks the fact that the Society was told no. They weren't told it was under active consideration. They were told, no, there's no funding this year. I actually don't understand it. You've got a small society, Mr. Speaker, who is delivering food and milk to children across British Columbia, and they're doing it for $8 per child per year. 80 cents per child per month. And how are they doing it? Because they've got access to 4,000 volunteers. They've got donations in kind from farmers, from agri-food producers, from shippers. It's working. I mean, is the government out looking to create problems? It's working, Mr. Speaker. And you know what occurred to me why we're asking this question yesterday and today? Is because when the Society made their application in February, again in March, and in April, and in May, no one in the government stood up to defend the children that they are feeding. No one. Not the Minister of Education, not the Minister of Health, not the Minister of Agriculture, not the Minister of Children and Families, and the Premier. Well, we know what the Premier had already decided. He was going to take the $4 million and hire some spin doctors for his own office. Mr. Speaker,
members,
a former Premier, a friend of the Premier's, I believe, Dan Miller once told me, he said, when you're in government, you got to know when to hold them and know when to fold them. It's time the government to fold on this one. Do the right thing, do the logical thing, do the appropriate thing, and reinstate the funding so that this small society can feed children right across British Columbia.
Minister of Agriculture.
Thank you, Mr. Speaker. Thank you to the member again for a very enthusiastic question. The member doesn't have to convince me about the value of this program, nor does he have to convince our government. We support programs like this. This is an excellent program that gets fruit and vegetables into classrooms around the province. We've been supporting it since we became government in 2017. I have to say, though, that obviously this has been a different year. When the association came forward with its request, it offered two different options. Those options are being analyzed. We do know that there's still $1 million left from last year that they have. So all of that information is being looked at, and we should have some news soon.
Member for Abbotsford West on supplemental.
Mr. Speaker, the minister pretends that the government didn't say to the society, there's no money. She knows what the budget for this program is. She knows that it costs between $3 and $4 million, and that translates into 80 cents per child per month across British Columbia. She didn't say to the society, we're thinking about it and we want to talk to you about some refinements. The government said no. And the government knew that May 10th was a hard deadline when the society has to say to their suppliers, we no longer are able to take your products. We are no longer able to distribute them to children right across British Columbia. The minister and the government are being way too cute, Mr. Speaker. This is hardly the hardest decision for a government to make at this time. Will the premier stand up, do the right thing, the logical thing, the appropriate thing, and simply tell the society and children across British Columbia they're going to get the fruits and vegetables with a program that has been working perfectly for 15 years?
Minister of Agriculture.
Thank you very much, Mr. Speaker. As I said, there should be some news soon.
Member for Saanich North End Islands.
Thank you, Mr. Speaker. In response to the death of a 12-year-old girl recently, especially young casualty of the poison drug supply, this government and the official opposition are advocating to bring back a bill that would involuntarily restrain youth. The death of this young child is tragic. No one in this province should die from a poison drug supply, especially a child. In the wake of this tragedy, we feel the weight of this toxic drug crisis even more. But let's not use this tragedy as cover for inadequate policy. Restraining children against their will, as written in last summer's Bill 22, would cause significant and disproportionate harm, especially to Indigenous youth. Bill 22 is a reactive policy to an inadequate system of care and sets up youth for further alienation. What we should be doing is setting up a proactive mental health care system that ensures everyone can get the help when they need it. What is needed is a culturally appropriate, youth-specific, youth-friendly, voluntary detox, intensive care, management, day treatment, and community residential treatment system. My question is to the Minister of Mental Health and Addictions. Will the minister resist calls to bring back this flawed legislation that has the potential to hurt more than it may help?
Premier.
Thank you, Honourable Speaker, and I appreciate the position of the member, but I profoundly disagree with it. Judy Darcy, the first ever Minister of Mental Health and Addictions in this country, worked tirelessly with all corners of this House. Jane Thornthwaite, former member from North Vancouver Seymour, former chair of the Children and Youth Committee, worked collaboratively to bring forward something. For the Green Party, perfection is always the enemy of progress. We had a youth die from opioid overdoses this week, and still the Green Party believes we should continue to flounder around rather than coming together collectively and never letting this happen again. I don't know how you can hold that position, member, after what we've just seen.
Member for Saanich North End Islands on supplemental.
Well, reminds me of last summer, conversation that we had. Bill 22 faced strong opposition, and yet it was politicized. It was the BC Greens, just as we saw here today. The BC Greens were the ones that were standing up against this bill. The BC Greens And as I said to the Premier in his office, we're only raising the significant concerns of a wide variety of stakeholders that were speaking out against Bill 22. But yet, only the BC Greens were the ones that were speaking out against that. Let's Chief Coroner Lisa Lapointe. Our Chief Coroner, quote, serious unintended consequences, including the potential for an increase in fatalities. The Premier won't mention that. The Chief Coroner said that this bill might negatively impact the work being done to reduce fear and stigma, something that we've been talking about in this session of the Legislature. The representative for children and youth, not being brought up in question period today. The representative for children and youth, only the Green Party were standing in the way of it. No, the representative of children and youth said they are disappointed by government's move to create involuntary stabilization units, stating the need for more urgent voluntary supports. The Premier's government not only heard from the Green Party, but they also heard, and the Chief Coroner and the representative of children and youth, but also the First Nations Leadership Council, the Nurses Association, the Union of BC Indian Chiefs, that this bill faced strong opposition because as it was written, it was not the solution to the problems that we face and could potentially make the situation worse. And that's exactly the advocacy that we brought to the Premier's office last summer. My question is again to the Minister of Mental Health and Addiction. Is her ministry focused on expanding the voluntary supports, or are they going to bring back the flawed bill that they put in front of this House last summer?
Premier.
Thank you, Honourable Speaker. And I was a 12-year-old drug user, and I wasn't reading statutes at the time. I don't think that anyone who's using drugs as a youth is concerned about the debates in this legislature. I don't think the parents of children using drugs are particularly concerned about the debates in this legislature. They want all of us to get our act together and protect young people. The direction to the Minister of Mental Health and Addictions is to consult, and she has been doing that. We will bring back the bill, Minister, and may well be an improvement in his eyes, but I reject his position that we have to find perfection before we step in and help people who need help.
Member for Kelowna Mission.
Thank you, Mr. Speaker. Another day and another COVID-19 data leak. But this time we have the Premier concealing data about COVID-19 transmission in schools. And while we're on the topic of children, in the absence of the data that was leaked, parents have been collecting their own, publishing this on Facebook pages and blog posts, desperate for the information to keep their families safe. Fraser Health has now been forced to publish a leaked presentation that shows the Premier had access to local schools' data about COVID-19 outbreaks and deliberately withheld it. Will the Premier explain why he is yet again hiding COVID data, this time about kids?
Premier.
Thank you, Honourable Speaker. And as I said to an earlier question in this regard, we have been following the direction of public health officials and the BC Centre for Disease Control. We've been doing that from the beginning to good effect. Here's some data for the member today. 2.16 million British Columbians have received a first dose of vaccine. Over 50% of British Columbians eligible have had their first dose. That's positive news for the future. I stand behind Dr. Henry. I stand behind the Centre for Disease Control in how they will apportion the data that they collect to protect British Columbians. It's been working to this point in time. I'm confident it will continue to work as we get to the end of the pandemic.
Member for Kelowna Mission on a supplemental.
Thank you, Mr. Speaker. Well, I won't quote the PHO, but I will quote the Premier, because last year he told British Columbians, and I quote, "Children are not transmitters of COVID," end quote. But the leaked data from Fraser Health clearly shows that student-to-student transmission is the greatest concern and occurred in the majority of identified cases. As Terry Mooring of the BCTF says, the leak shows, and I quote, the opposite of what we were told, end quote. Will the Premier explain why he kept families in the dark about COVID transmission at schools when he has access to the data that parents want?
Minister of Health.
Thank you, Honourable Speaker. The member will know on April 15th, because her caucus received a detailed briefing about this, as did the Green Party caucus and many other people, that Dr. Bonnie Henry presented on April 15th modeling data with respect to school cases, both in Fraser Health for the period in 2021 and in Vancouver Coastal Health for the period in 2020. Subsequently, Fraser Health provided that data to superintendents and posted it publicly on Tuesday.
Member for Surrey South.
Well, thank you, Mr. Speaker. And another day, another leak. The Premier buried a report on COVID-19 in long-term care homes and called an election. Frontline workers at the BC CDC felt they had to leak the information last week, and now it's happened again with Fraser Health school data. The leaked data shows that Surrey had the highest number of COVID outbreaks at schools and also had the highest number of variants of concern. The leaks show that the data that the people have been demanding be made available. Why wasn't it done sooner, Minister?
Minister of Health.
The provincial health officer on April the 15th provided a briefing to people across British Columbia. It was done on provincial television, and it was made available to everyone. The member talks about previous reports, and frankly, a report that was concluded after the election could not have been provided before the election. So with great respect, I think that what's important right now is that we focus on what Fraser Health is focusing on, which is immunizing people in Surrey and dealing with issues of transmission. The extraordinary effort that's been made just in the last week, never mind over the period of the pandemic, by healthcare workers and staff in Fraser Health, is something to be recognized. Today, people across BC, over 50% of adults across BC, will have been immunized were immunized by the end of day yesterday, and that includes in both local health areas in Surrey. There are efforts across the community health service areas in Surrey, to especially hotspots, to raise levels of immunization. That's precisely what we're doing, and we're doing it working with MLAs on all sides of the house, working with community groups, working with Gurdwaras, working with mosques, working with everyone across the community. And those efforts that have registered 500,000 people in 9 days have been led by the Premier, and those are the right efforts for us to do right now. People need to get registered, they need to get vaccinated, and all of us need to follow provincial health guidance and orders.
Member for Surrey South on a supplemental.
Well, government is certainly playing catch-up on Surrey. This leaked data also showed that Surrey had the most significant burden of school exposure notifications and isolation orders. And what did the Premier give them? Pop-up clinics and a Hunger Games vaccination plan. Parents want to know that their kids will be safe at school, and they need transparency from this Premier and this government. As Terry Mooring says, the leak shows, quote, the opposite of what we were told, end quote. Why did the Premier ignore the concerns of Surrey residents and teachers and keep them in the dark about COVID data at schools?
Minister of Health.
Honourable Speaker, the provincial health officer and our public health officials in both Vancouver Coastal and Fraser Health have done extensive work, and the public was briefed on that work, and further details were provided to superintendents and posted publicly earlier this week. The situation in Surrey, and we present data around Fraser Health every single day, it shows that since last year, in the middle of last year, Fraser Health overtook Vancouver Coastal Health as the center of the pandemic in terms of cases. And that case has been made and demonstrated in data throughout that time. Over the last week, people in the hundreds of thousands in Fraser Health have been immunized. And the reason is that we have an extraordinary team of people. And now we have this supply a vaccine, and those efforts are going to continue. Surrey is obviously, amongst large communities in British Columbia, our top priority, and that is reflected in our actions, in what has occurred in this time. And I appreciate the support of the honourable member for those efforts. I know she does, and I know that members on all sides of the House support them. So we have to get on with it. Get registered, get immunized, follow provincial health guidance. Right now, we have to live in the present, and that's what we all need to do.
Member for Fraser-Nicola.
Well, Mr. Speaker, I wrote to the Health Minister on January 11th, asking him, on behalf of educators and parents of school-aged children, to provide more detailed COVID-19 data. I asked him specifically for case breakdowns of schools identified by staff and student populations. This government never responded. They hid the information instead. Will the Premier share the kind of school COVID data that has leaked for the whole province, and will he continue to keep parents in the dark about their children's safety?
Minister of Education.
Well, thank you very much, Honourable Speaker, and thank you to the member for the question. We all share a deep concern to ensure that our children are going to school and that staff are working in safety in our schools. I would say that with respect to the information that has been provided, both in Vancouver Coastal Health as a result of their analysis done with respect to in-school transmission, and the information done by the Fraser Health Authority, both studies which were presented to the public in the April 15th modeling update by Dr. Henry. That information has demonstrated, in fact, that our school safety plans are working. We know that in the case of Fraser, where we have Surrey rather, in particular, we have 77,000 students attending school in Surrey. We have 10,000 staff working across that health authority. And we know that across that district, 1% of the in-school population tested positive. And the really good news coming out of that study is that 87% of COVID cases that showed up in school, in fact, were acquired elsewhere. They weren't acquired in school. And even more importantly, a case that did arrive in a school only resulted in transmission to one or two other individuals. So what those really important studies, what that really important work that our health authorities have done demonstrates is that, in fact, our safety plans are working. And they're working because of the extraordinary efforts of teachers and educational assistants and custodians and principals and superintendents and, of course, kids themselves who are all in, working hard to ensure that we're keeping our schools safe so that kids can continue to learn in school. Thank you, Honourable Speaker.
Member for Fraser-Nicola on the supplemental.
Other regions are worried about the COVID data in their school districts also. The leaked data from Fraser Health includes part of what we've been requesting regarding schools, breakdown by school district, geographic breakdown, staff and student numbers, and information on variant cases in schools. We now know that the Premier has access to this data, and keeping information secret adds to the stress. Will the Premier tell parents across the province that he will share the COVID data he has on schools, or will we have to wait for another data leak?
Minister of Education.
Well, thank you very much, Honourable Speaker. And again, I'm grateful to the member opposite for, again, the concern that we all share during this unprecedented time with respect to keeping kids safe. I can tell you that we work every single day with our partners in the education system, and also with our partners in the BC CDC, with medical school health officials in the health authorities. And those individuals are working together at our provincial steering committee, where in fact we met earlier this week and reviewed the information that had come out of Fraser. People in leadership positions in the education system have direct access to our public health officials, and our response across all health authorities is led, in fact, by public health. And we will continue to do that work, continue to communicate, continue to work across all sides, with all of our partners to ensure the safety of schools. Thank you very much, Honourable Speaker.
Opposition House Leader.
Thank you, Mr. Speaker. Well, yesterday the Premier claimed that he made no direction regarding the sharing of data. In fact, he said, and I quote, "The data issue was in the hands of the BC CDC. At no time did I direct them to do anything," end quote. Well, Mr. Speaker, the Premier could have directed them to release the information at any time. Of course, the Premier could have also directed the Poverty Reduction Minister to end the clawback, but he's just one member at the Cabinet table, I guess. He could have directed the Ag Minister, the Health Minister, the Education Minister to not cut the funding to the fruit and vegetable program. But the Premier did know how to direct staff, Mr. Speaker, when he made sure that his office was directed to get an extra $4 million so he could have some spin doctors to work on upcoming photo ops for the Premier instead. The Premier has choices. The Premier could have released the data. Instead, he has chosen not to. Can the Premier explain why he chose to withhold the information and keep the information private?
Premier.
Thank you, Honourable Speaker. And for the party that took away bus passes from people with disabilities, they actually did that, Honourable Speaker. They actually did that. We increased income assistance and disability rates by the largest amount in history in this budget. And we have been following the lead of public health officials through the gravest time in our province's history because it was the right thing to do. At no time did I direct anyone to withhold anything. I relied on Dr. Henry and her professional team and the great nurses and doctors in this province to get us through this. Now, I think it's okay for the House Leader of the official opposition to stand and recite what he got from the kids in the basement, but the reality is British Columbians are thankful that we're almost at the end of the gravest year in our history because we've been collaborating and working cooperatively across sectors, across industries to make sure that all British Columbians can be safe, and when we come out of this pandemic, we're stronger than we went in it. That's why we're on this side of the House, and that's why you're on that side of the House.
Opposition House Leader on supplemental.
Wow, I can only imagine what the Premier's like as a boss to his own staff if that's the disdain he has for where people are located in a building for working. So let's look at
members. Opposition House Leader has the floor.
Well, Mr. Speaker, the Premier seems to be missing the point. He could have directed that the data be released instead of being hidden for the last 14 months as community groups, parents, other agencies have been looking for the data, the media have been looking for the data. In fact, I'll remind the Premier, Mr. Speaker, what he said last August, because he seems to always forget the promises and commitments he makes, it seems. Last August, this is what the Premier had to say about COVID, and I quote, "At the end of the day, the decisions rest with me and my government," end quote. Funny, yesterday he wanted to make sure everyone knew he doesn't direct anyone to do anything, it seems, in his government. Again, frontline workers are feeling like they have to leak information because this Premier is choosing to hide the information. So instead of cheap shots at people that work in this building, perhaps the Premier could actually answer a question up front for once. Why is he hiding information, and will he stop hiding data moving forward?
Premier.
Thank you, Honourable Speaker. And again, public health officials led by Dr. Bonnie Henry have been briefing British Columbians every day for 15 months. We've been laying out data on outbreaks in particular parts of the province, and we've been managing that. The data in and of itself is not a tool for anything other than better outcomes for people. We use the data to deliver health services for people. Now, I know that for the official opposition, and particularly the opposition House Leader, it's just a club to beat someone over the head with. But for professionals in the health sector, the data informs how they respond to situations. That's how it should be. Thank goodness we're here to make sure that happens.
The bell ends the question period. Attorney General. You have a document to table? Okay. Government House Leader. Madam Clerk. Does member for Vernon Monashee has something? All right, member, proceed.
Yes. Thank you, Honorable Speaker. I'm submitting this petition on behalf of 46 senior condo owners in Vernon. It's regarding the excessive insurance premiums that are being charged, and they're hoping if government can do something. And there have been some actions taken. They're appreciative of that.
Thank you. Madam Clerk.
Orders of the day.
Government House Leader.
Thank you, Honourable Speaker. In this chamber, I call Bill 13, Employment Standards Amendment Act, second reading. And in the Douglas Fir Room, Section A, I call Ministry of Advanced Education and Skills Training estimates.
Minister of Labour.
Thank you, Honourable Speaker. I move that Bill 13 be read a second time now. Mr. Speaker, many workers wake up in the morning with a sore throat and a difficult choice. On one hand, if they feel sick, they could stay home. This would be the right thing to do for their own health, the health of their co-workers, and could help stop the transmission of COVID-19 at workplace. Or they could push through and head into the work because they just can't afford to stay home. They can't just stay. They just can't afford to lose a day's pay. This, of course, put their co-workers at risk and could lead to an outbreak. This is what we are discussing today with Bill 13. Since the beginning of this pandemic, we have been lobbying the federal government to bring a paid sick leave program for all workers in Canada, and we continue to feel this should be a national priority as this is a national emergency. No worker should have to choose between going to work sick or staying home, lose pay. We're stepping up and providing what is needed now and for the future for the workers of British Columbia. There are two significant improvements under this bill, amending the Employment Standard Act. First is an immediate measure on a short-term basis to support workers as we continue to battle COVID-19. The amendment would provide up to 3 days of paid COVID-related sick leave for employees who are on leave in one of the following situations. They have been diagnosed with COVID-19 and are acting on the instruction or order of a medical officer or advice of a medical practitioner, nurse practitioner, or registered nurse. They are in quarantine or self-isolation in accordance with an order made by the provincial health officer. Mr. Speaker, that's what this bill would do, cover those situations. Or they have been directed by their employer to stay home because of concern about an exposure risk to others. Honourable Speaker, this will mean that employees who do not currently have access to paid sick days will be able to take days off to get tested without losing pay when they have COVID-19 symptoms for the duration of this paid leave from Royal Assent until December 31st, 2021. We know that the most efficient way to prevent transmission of COVID-19 is to self-isolate, to stay home and not go to work when you're sick. But for too many workers, they cannot afford to take unpaid sick leave. Many workers live paycheck to paycheck, and every dollar counts towards rent, food, and other necessities. They can put workers in an impossible situation where if they go into work when sick, they could be putting other workers, co-workers, and others in danger. But by staying home, they risk their job, food on the table, and their home. A paid sick leave or COVID-19 helps ensure more workers don't have to make that choice now during the pandemic. And for employers, knowing that the workers are making a choice to stay home when sick should help keep workplaces safe and healthy for other workers and customers. which can reduce the likelihood of an outbreak that can result in a closure order of 10 days by public health. This paid COVID-19 leave will not replace the federal Canada Recovery Sickness Benefit, which provides $500 weekly up to 4 weeks when workers miss at least half of their scheduled work week because they are ill or self-isolating due to COVID-19. Rather, BC's proposed COVID-19 sick leave will provide financial support to workers who find themselves in situations not currently covered by federal program. At the same time, we need to support businesses who are already struggling to survive due to pandemic. So the province will reimburse employer up to $200 a day for up to 3 days for each employee who take this COVID-19 paid sick leave. This means workers won't lose pay while waiting for their COVID-19 test result, and employers will be supported in covering those costs. In accordance with the amendment under this bill, employers will be required to pay employees their average day's wage for a COVID-19 sick leave day. Employer will then be reimbursed by province up to a maximum of $200 a day per employee. This program will be administered by WorkSafe BC, who have the tools and experience working with employers to run a reimbursement program of this scale. Honourable Speaker, we expect to have employer reimbursement support fully operational as soon as we can, and employers will be able to quickly and efficiently access their reimbursement. We have seen many businesses step up to support their workers because they understand we are all in it together. The second part of this bill addresses ongoing concern about the need for permanent paid sick leave beyond pandemic. Employment standard legislation in Quebec, Prince Edward Island, and federally regulated workplaces provides employer-paid sick leave entitlement for employees. Honourable Speaker, this pandemic has made it clear that we must ensure paid sick leave as a basic protection for workers across this province. So looking beyond the specific COVID-19 paid sick days, which ends on December 31st, 2021, the bill adds to the Employment Standard Act permanent annual paid leave for personal illness or injury. Last year, we added 3 unpaid days for personal illness or injury, and this bill will add new paid days and preserve the existing unpaid job protected leave entitlement. These new annual leave entitlement will be effective starting on January 1st, 2022, and the minimum numbers of annual paid days will be established by regulations. This means that the government will undertake extensive consultation with workers, employers, Indigenous partners, and other stakeholders on the number of paid days that employees would be entitled to each year for personal illness or injury, and whether any other support need to be identified. Establishing long-term permanent paid personal illness and injury leave in Employment Standard Act will not only help us assure financial support for employees who miss work because they are sick or injured, it also encourages employees who have infectious diseases such as influenza to stay home, thereby speeding up their recovery and protecting their co-workers and public. The COVID-19 pandemic has taught us just how important it is. Mr. Speaker, as I noted earlier, for the short-term measures, BC's COVID-19 paid sick leave, the province will help cover the cost for businesses so we can all get through the pandemic together. This is an interim measure to support workers and businesses during these extraordinary times. We are not alone in recognizing the need for this important support for employees and businesses either. Ontario recently passed a law providing paid COVID-19 related sick leave up until September 25th, whereas our government-funded sick leave for COVID-19 will be in effect until December 31st of this year, after which the second improvement under this bill, permanent paid personal illness or injury sick leave, will come into force on January 1st, 2022. Honourable Speaker, this bill, along with the substantial commitment to support employers with the cost, comes on the heels of several important actions the government has already taken to support workplaces during this pandemic. Last spring, this government passed the Employment Standard Amendment Act 2, 2020, Bill 16, which introduced a job-protected leave entitlement to employees impacted by COVID-19, including when they have diagnosed with virus, are in self-isolation, or need to stay home to look after a child because of a school or daycare closure. Mr. Speaker, I think people listening will be surprised that in British Columbia, we did not have a right for the workers to take time off when they are sick. It was up to the employer to give you that time off or not. You could lose your job if you're sick and stay home. We fixed that because COVID-19 required us to deal with those issues at that particular time. That happened last year. Also, Mr. Speaker, most recently, April 1st, a regulatory change was made that extended the job-protected leave to include employees being vaccinated against COVID-19 or assisting a dependent family member to do the same. And then last month, we put in place 3 hours of paid leave for workers to get each dose of the vaccine. All these measures are contributing to British Columbia's pandemic recovery, and they are working. Among other things, the pandemic has highlighted just how difficult it is for many workers in our society to stay afloat and thrive. Our government believes that no worker should have to choose between staying home when sick or getting paid during a pandemic or any time. So to better support workers and healthy workplaces in the long term, the second improvement under this bill lays the groundwork for a permanent paid sick leave for those who cannot work due to personal injury or illness. It is estimated that 50% of British Columbia employees do not have access to paid sick leave and must choose between going to work sick or they could support their families, possibly infecting others, or staying home and lose pay. That means that upward of 1 million workers could benefit from the improvement we are introducing today. We know that many vulnerable and low-wage workers, who are often women and migrant workers, lack benefits. So the ability to take employer-paid leave will especially beneficial to them. And many of these workers are essential workers who have delivered goods, who have made food for pickup, or who have been working fearlessly in grocery stores to make sure we can all get the supplies we need, get the services we need. Mr. Speaker, throughout the pandemic, we have done everything possible to support businesses and individuals, and we will continue to do so during our economic recovery. In the following months, we will be consulting to develop a model for permanent paid sick leave that will be fair, reasonable, and affordable for employers. Businesses know that a strong, healthy, and engaged workforce is the most valuable asset they have. They know that supporting their workers and ensuring a healthy and safe environment helps their businesses thrive and is key to their overall success. Honourable Speaker, we want British Columbians to know their government has their back throughout this crisis, and together we will get through this. And I look forward to the debate on this bill. Thank you very much, Mr. Speaker.
Thank you, Minister. Recognizing the member for Shuswap.
Well, thank you very much, Honourable Speaker, and I'm very proud to rise today in the House to speak to Bill 13, Employment Standards Amendment Act 2, 2021. As the Minister has laid out, this bill provides protection, paid leave for protection for workers for a maximum of 3 days. And we are certainly in support of a government-funded sick pay program in the middle of the worldwide health pandemic. It's important to note that, as the Minister has indicated, that workers that are ill should not be needlessly lose income when they decide to stay home from work. And I think that it's important to see that this bill actually comes forward And again, broad support from our caucus for the government-paid support for workers. But it's really important that we also take note of the timing of this particular bill. And I think that as I've been conversing with businesses back in my home community and industry and trade organizations, and even just in reading the newspaper and seeing some of the media reports, the concern that has been brought forward is why it has taken so long for this paid sick leave program to be brought forward. COVID has been with us now for going on 15 months. Last year in March, all members of this legislature came together in unprecedented fashion and approved a $5 billion COVID spending plan to provide government the resources so that they could do everything within their ability to help reduce the transmission of COVID in the workplace. The Premier, through his own admission, has indicated that one of the second largest COVID transmission in the province is actually transmission that happens in the workplace or workers that are bringing COVID back to their families at home. So it's no great surprise, I don't think, to British Columbians in general or this government of the challenge that workers have faced for now going on 15 months. And so we must ask ourselves, why is it the government has waited so long to introduce this very important piece of legislation? Government was aware of the problem, knew that by effecting a sick pay program would actually help to reduce the amount of COVID transmission, and yet the government has chosen to wait until now, we're going into the 10th week of this legislative session before introducing this very important piece of legislation. Last summer, when the Premier announced that he had a program or a plan ready to deploy, but chose to stall out and to withhold the opportunity to actually move this important piece of legislation forward. Government had the financial resources through the $5 billion COVID spending plan that was approved by all members of this House. He was aware of the challenge and the problem and the incidence of worker transmission and the transmission from COVID from the workplace back into families' homes, and yet they have failed to act. And so, Mr. Speaker, I'm certainly very concerned, as I know many British Columbians are, is why have we had to wait so very, very long for this important piece of legislation? We had a summer session of this legislature. There was ample opportunity to bring forward this legislation during the summer session. There would have been opportunity to bring this legislation forward during last fall's, the typical fall legislative session during the months of October and November. But that was not available because the Premier chose to put his political self-serving interests ahead of the health and well-being of British Columbians and throw us into an unnecessary and risky snap election. When we came back after the election in December, there was ample opportunity to bring this bill forward. And for the paid sick leave program, supported by government and government funded, it's my estimation that there would be unanimous support for that. But we didn't see the legislation last summer. We did not see the legislation come forward last fall. We did not see it come forward in December. And when this 42nd sitting of the legislature started on March 1st, again, we did not see this bill come forward. We didn't see it in April. And here just yesterday, we finally seen this piece of legislation that British Columbians and health officials know will reduce the transmission of COVID in the workplace. British Columbians are looking for leadership from this Premier. But the Premier chose to stall, to delay, and here we are 15 months into the pandemic before they've finally chosen to take action. is very concerning, Mr. Speaker, and I think British Columbians also should be rightfully concerned. What Labour leaders across the province are indicating, it's far too little, far too late. The $200 cap that government is providing funding for through this legislation for up to 3 days is a great start. At $200 a day, that will be equate to an employee making approximately $25 an hour. The Premier and the Minister of Labour have been on record in recent months talking and actually finally agreeing and understanding that businesses across the province are struggling. We've lost 8,000 businesses due to COVID just in the last year. There's another 25,000 businesses that are at risk, businesses that cannot afford any additional cost burden placed upon them. And the Premier and the Labour Minister have made that comment, have made that statement that businesses can no longer afford any additional cost burden. And yet, any employment income over $200 a day will actually be put on the backs of BC businesses. Now, some may say that's a small component, it's a small price for businesses to pay, but it still is an extra cost. And it's something that needs to be recognized, is that the Premier had indicated that a paid sick leave program during the pandemic would not be providing further burden to businesses that are already struggling. And yet, that is exactly what this bill will do. So, Bill 13, for those watching from home, there's two main sections. The first piece, as the Minister shared, deals with the support for workers during COVID. And I've spoken, at length about the challenge on why we have waited so long for this. But as the Minister indicated, this particular bill, which will come into force and effect when this bill receives royal assent, will be in force and effect until December 31st. Now, the second portion of this bill has to do with a permanent sick leave program. Now, the permanent sick leave program, I was fortunate enough to have a briefing from ministry staff yesterday, and there's some specific questions that I think British Columbians and business owners need to have answered as they ascertain what this legislation and what this bill will actually mean and how it will impact businesses going forward and the impacts for workers. So I asked the question, how many days is government considering for a permanent sick pay program? They don't know. How will that be funded? Will it be funded through government sources? Will the entire cost be put on the backs of BC business owners? No answer. For a government that talks about being open and transparent, there is no substance within this bill that provides any direction to employers or employees or workers across the province with respect to the impact that a permanent paid sick leave program will actually provide. No answers. Now, when we look at, when I consider the comments of the Labour Minister with respect to the consultation that is yet to be undertaken, I can't help but ask myself, where was the consultation, where was the business outreach that was actually undertaken last year during COVID? The Minister referenced a number that approximately, his best guess, is that about 50% of workers in the province are currently not covered by a paid sick leave program. When I asked the question on what research or efforts were undertaken and where that data came from, staff within the Minister's office was unable to answer that. They just said it's an approximation. So I think that most of us would appreciate the fact that data drives decisions. I believe it was just the Premier today during question period commented in this legislative chamber that data informs how decisions happen. Let me repeat that. The Premier in this House today made the comment, data informs how decisions happen. And yet, when I asked questions about how were the decisions arrived at, which led to the creation of this bill, there isn't any. There isn't any data. Government, for the last year, did not undertake any business surveys. They did not utilize WorkSafe BC to even make an attempt to try and identify the breadth of the problem, the number of businesses that currently do not have a paid sick leave program. So when the minister stands here today and shares with British Columbians, trust us, we've got no information today, we have no details on what a permanent paid sick leave program may look like. Trust us, we'll do the work, and we'll make the decisions for you in January of this coming year. Now, the January 1st deadline, that is a self-imposed deadline. That is a deadline. That is a date by which government has undertaken to determine for themselves. So when we have a look at the need and necessity and the opportunity to consult with business owners, to consult with workers around the province, to have a look at other jurisdictions around the globe, to have a look at what efforts might be undertaken to develop and determine a paid sick leave program for businesses. No work has been done to date. It is yet to be seen what work may go or be undertaken going forward. That's concerning, Mr. Speaker. We are here on May 12th. We have about 5 weeks left in this legislative calendar. And I certainly appreciate the fact that the first section of this bill with respect to the immediate government-funded paid leave program needs to be put in place. It should have been put in place a year ago. Many workers were put at risk and families were put at risk because of this government's failure to act earlier. They had the funding, they had the budget, they knew the risks that they were transferring to workers and to families, and yet they chose to act. The necessity of putting this piece forward with Section 1 is something that we've been waiting for, and I think businesses and trade organizations around the province have been waiting for a long, long time. However, when it comes to the second section of this bill that talks about the development of a permanent sick pay program that could literally put hundreds, if not billions of dollars of additional cost pressure onto businesses, and of course we don't know that, there is nothing in this bill that identifies what government is proposing. It's a subversion of the democratic process. The reason that we are all here and we are having these debates today is so when government brings forward important legislation, opposition members have the opportunity to ask specific questions, to make inquiry, to seek out the truth and the answers on how government arrived at the decision that they're moving forward on. But Section 2 of this bill provides government the opportunity, without any information, to make up their own minds, to make their own decisions, and through regulation, through an order in council, sitting around the cabinet table, put in place a regulation that could cost significant dollars to the economy and to businesses. And that, Mr. Speaker, I believe is offensive. We're only in May. Government's own self-imposed deadline for a permanent sick pay program is not until January 1st. January 1st. Government has admitted and shared that there will be a fall legislative session. We'll be back here in the months of October and November. We've not seen the legislative calendar as far as the different bills or legislation that government will be looking to bring forward, but there is ample time for government to do their consultation, to bring forward legislation that has more fulsome details on what a permanent sick pay program might have. And to present that legislation in a fall legislative session, providing opposition members, British Columbians, and the media to have an opportunity to really understand exactly what government's motivations are, the consultation that they've undertaken with business groups, First Nations, and workers across the province, so that British Columbians can be satisfied that the decision that government is making, or the direction they're moving in, is well understood. But Bill 13's, the second section of this bill, does the exact opposite. It empowers government to make that change at their own free will. And we have to ask ourselves, why are we here? The purpose of this legislature, the fact that 87 members have been elected from around the province with diverse different backgrounds to provide us the opportunity as the representatives of all British Columbians in order to have a fulsome knowledge of what government is planning to do, who is going to pay for it, how many days of sick pay would be provided to workers, what research, what other data was derived to help direct government to making a decision going forward. But none of that will exist with respect to this particular piece of legislation on Section 2. So I'm extremely concerned, Mr. Speaker, and as we know, the paid sick leave program is something that many have been looking for a long time. And I'm just going to go back to Section 1 of this bill, which is the government-funded paid sick leave program. It's interesting, Mr. Speaker, that here we are on May 12th, 15 months into the pandemic. Premier Horgan announced last summer that he had a plan ready to go. It was shelf ready.
If I might remind the member, we don't use names in this House.
Thank you, Mr. Speaker. My apologies. So the Premier announced that he had a program ready to go on the shelf. And yet, in my briefing yesterday, when I asked a specific question about who is going to administer this program, one of the answers that I received is that the database program and the work that will be undertaken to determine how business owners will be reimbursed under the 3 days of paid sick leave, it is yet to be developed. It was shared that the funding mechanism largely will be through WorkSafe BC, and the answer that was shared with me is about 90% of businesses are registered through WorkSafe BC, but that failed to identify how they're going to identify the other 10%. And the actual mechanism by which they'll actually track the data and be able to actually provide remuneration to those businesses has yet to be developed. They're undertaking to have this ready to go in 30 days. I think we're 15 months into the pandemic. Government must have thought, or I certainly would hope they would have thought of, a year ago that, look it, we can reduce COVID transmission through a paid sick leave program. We should be turning our minds to the mechanism by which we might utilize to actually provide reimbursement to businesses. But none of that work has been done. So when the Premier talks about the work that was done in the shelf-ready program, I don't see it. If this bill was to move forward and receive royal assent later this week or next week, business owners will be required to continue to provide that pay under the provisions of this bill for paid sick leave. And the system and the mechanism by which they can actually even make application for reimbursement doesn't even exist. Talk about a government that's flying by the seat of their pants. There was no fully developed plan that was ready to go. They're making it up on the fly. I asked the question, will government undertake and guarantee that businesses who will be negatively impacted by cash flow, by having to pay workers and then wait for reimbursement from businesses, is there any commitment by this government to ensure that businesses will receive reimbursement within a minimum set amount of days? 15 days, 21 days, 30 days, no commitment. We know the botched programs that we have seen under this government's administration with respect to the COVID Restart program. A program that British Columbian businesses sat waiting for earnestly month after month after month. Well, the Premier dithered and delayed only announcing the COVID Restart program in September of last year, a full 5 months of consultation, trying to figure out what they might bring forward to help businesses. Businesses needed support last year. They needed support in the months of March and April and May and June and July and August and September. Finally, September, the Premier announces the $345 million COVID Restart program. To only 4 days later, drop an unnecessary and risky snap election, further delaying the opportunity for any of those dollars to flow to help those businesses for a further 3 months. 8 months, not a penny flowed to help struggling small businesses. And we know that program is still an absolute failure. Here we are, over a year in, 15 months into the pandemic. It's my understanding only about 50% of the dollars that were identified and earmarked to help struggling small businesses, only 50% of those dollars have actually flowed into the hands of those businesses. But we have a government that says, trust us, we'll just make it work. There's the most barest skeleton semblance of a plan for how government is going to actually provide reimbursement to businesses. This bill could be enforced in effect before government has even figured out how they're going to do it, and there's no commitment with respect to the implications of the cash flow on businesses and how long it will take government to provide that necessary reimbursement for businesses that are already struggling. Mr. Speaker, during COVID, we know that frontline workers were put at significant risk. The 20 to 39-year-olds that the Premier chastised by saying, don't blow it for us, those are the workers that could have benefited from a paid sick leave program last summer, last fall, this winter, earlier this spring. But what do we get from this government? Delay. Delay, delay. As we look to the future, to recovering from COVID, and hopefully providing the opportunity for businesses once again to thrive, to provide that all-important family-supporting jobs around our province, opportunity for the private sector to attract investment, to continue to grow. We have to have a look at what businesses require of government, and that's certainty and clarity. The biggest risk to business, largely, has to do with the uncertainty that lies ahead. And government has an opportunity, and I think an obligation, to provide that certainty and that clarity to businesses, especially when giving consideration to legislation that could potentially, because we just don't know what government is thinking, put additional cost burden yet on the backs of BC businesses. Bill 13 provides no such thing. The only thing that is certain is that it will become permanent on January 1st of 2022. Businesses have no idea about the potential financial impact that that legislation will have on them. They have no idea and no certainty or clarity from this government with respect to how it will be funded. And that's cause for great concern. How can a business plan for their future when this government is purposely trying to subvert the opportunity for this House, the People's House, to have a fulsome debate, to see exactly what government is thinking with respect to a permanent paid sick leave program, by hammering it through with no details whatsoever? Mr. Speaker, that is offensive. Now, I think that, I see I've just got a few more minutes on the clock. As we talk to or look to recovery and what businesses provide for British Columbians, I think we can all appreciate that businesses provide many services that we all rely on, but they also are government's single largest source of revenues, and that personal income tax provides the single largest revenue source for governments. And government needs to always be cognizant and recognize the fact that without businesses, without business owners that are willing to take that risk, to put a second mortgage on their house, to create those ever-important family-supporting jobs, without those individuals having certainty and the opportunity to be successful, those jobs will not exist. And what we have seen under this administration is a continual erosion of the competitiveness of British Columbia. In just 4 short years, we have seen increases in the corporate tax. The corporate tax rate in British Columbia is now a full 50% higher than our neighboring province of Alberta. 50% higher. We've seen a new employer health tax where the government has broken their commitment and promise. Their promise in the 2017 election was that they were going to eliminate MSP premiums. They did no such thing. They simply replaced it with a new employer health tax that puts an additional $1.9 billion tax burden directly on the backs of BC businesses. It's the lack of certainty that I'm concerned about. And so as government looks at how we're going to recover from COVID, it's really important that they give recognition to what measures are they undertaking to provide businesses with a chance for success. And I don't see that happening under this current administration, and that causes me significant concern. So back to this particular piece of legislation, very happy to see it finally on the floor of this House for debate. It is far too little, far too late. And don't take my word for that. All you have to do is scan the newspapers and the TV for many of the comments that are coming from labor organizers and large industry around the province. That is far too little, far too late. And it will just close with, again, the piece that I think is most concerning. Government had an opportunity to reduce COVID transmission in the workplace and transmission from workers to families, and they failed to act. They had the money, they had the knowledge, but they have failed British Columbians in a big, big way by taking so long to put this bill before us. And with that, I'll take my seat. Thank you, Mr. Speaker.
Thank you, member. Recognizing the member for Langley East.
Thank you, Honourable Speaker. It's a privilege to rise virtually in this House to speak in support of Bill 13, Employment Standards Amendment Act, and it was another interesting moment from our member opposite here during his comments of whiplash. We're not doing enough. We need to do more. Wait, why are you doing anything? But today, I would just like to say I'm so proud to be able to speak in this House today about the action our government is taking. And yes, we're disappointed that the federal government failed to lay out a comprehensive paid sick leave program for all Canadians. But our government is committed to working so that workers can stay home when they're sick, both during the pandemic and afterward. No one should be forced to choose between staying home when sick or getting paid. And this bill is essential not only to support workers who cannot afford to lose wages, but also to protect workplaces and businesses in our community. Since the outset of this pandemic, British Columbia truly has led the way in supporting workers and making sure that they don't go to work when they're sick. And as a result of this legislation, if a worker wakes up in the morning and they feel unwell, they can stay home in self-isolation and get tested without worrying about losing their income. This is good for our economy. This is good for workers, businesses, and it's good for families. And it's going to help avoid workplace transmission and help put this pandemic behind us faster. For a moment there, Honourable Speaker, I thought I had entered an alternate universe. But then I just realized that perhaps not everybody takes the time to become informed before they speak. And that's okay. These opportunities exist so that we have a chance to go back and forth and debate them. And hopefully at the end of the day, people feel they have the information that they need. So yes, this legislation will create a permanent paid sick leave for workers who cannot work due to any illness or injury beginning January the 1st, 2022. Following consultations with the business community, labor organizations, Indigenous partners, and other stakeholders, the number of paid sick days and other supports will then be determined. I'm always perplexed by comments, though, from the opposition of this nature, because I shouldn't be, because being in local government, I remember what it was like to have a stark lack of consultation from the opposition when they were the governing party. But that's not the way it works now. Our government is committed to consulting to make decisions that are informed. And maybe these comments were just a case of projecting, I'm not sure. But yes, data-informed decisions that are required, including all sorts of methods like consultation, instead of a magic 8 ball, are how this government wants to make decisions. So once again, in case it was missed, on May the 11th, the press release clearly said, the number of paid sick days and other supports will be determined following consultations with the business community, labor organizations, Indigenous partners, and other stakeholders. But this, once again, Honourable Speaker, shouldn't be a surprise, because a few weeks back, the member opposite that just spoke spent an inordinate amount of time arguing the Bill 3 Employment Standard Act amendment that perhaps workers wouldn't use the time appropriately that's allotted for them to get their vaccinations. So this really shouldn't be a shock. So, Honourable Speaker, I must really ask who's dithering. So an estimated 50% of BC employees do not currently have access to paid sick leave. That means upwards of 1 million workers in British Columbia will benefit from receiving these new paid sick leaves. And that's a good news story. The ability to take paid leave will be especially beneficial to many vulnerable and low-wage workers, often women or migrant workers who lack benefits. As a single mother myself, working in the restaurant industry, in hospitality, and as a farmer, I come in contact with people and have come in contact with people where they have come to work in a state where it was shocking, and you ask why, and they said, because I can't afford to. I have children at home that rely on me. I have a family I'm supporting, and that's not good enough. We need to support those people, and our government's committed to do so. And that ability to take paid leave will support our most vulnerable. And that is a good thing. So across Canada, workers are pushing for action because they shouldn't have to choose between going to work sick or a loss of income. and our government has put forward a bill which makes important first changes with the intent to consult moving forward. And that's something I'm proud to speak in support of, Honourable Speaker. And with that, I will take my seat and let my colleagues speak on this fantastic bill also.
Member for Kamloops South Thompson.
Well, thank you, Mr. Chair, and I am pleased to rise and speak to Bill 13 today as well. And I want to first start off by acknowledging the comments made by my colleague from the Shuswap. He, as always, speaks with such knowledge and passion when it comes to ensuring that workers and businesses, that employees and employers have the tools that they need to ensure a successful workplace for everyone. And that probably doesn't come as a surprise because the member from Shuswap is a successful business person in his own right. He employs hundreds of people and has for many, many years. And so I always pay a tremendous amount of attention when he's speaking on legislation and proposed policies or changes that involve the workplace, because he is speaking from a place of knowledge and experience. And I think that adds a lot to the debate. I too hope to impart some of my expertise as a business person. I am very proud of the fact that I have started a number of businesses, and a software company in particular, and that I grew that company with some incredibly talented people for about 15 years. And frankly, speaking of the people, the workers, the talent that we were able to attract in our company was really why we were successful. It was their efforts. And not a day would go by that, as their employer, not a day would go by that I didn't worry for and be concerned about the well-being of my team. And that is why we had a very generous benefits package. That is why we tried to do what we could, and we were able to do more and more over the years as we got larger. But we always tried to make sure that our employees had a safe workplace. We always tried to make sure that our employees could look after their loved ones. That is why we had good benefits packages in place, because it wasn't just about that woman or that man that showed up each day to work shoulder to shoulder with you. It was also about their family. It was about their spouses and their kids. And so it is in that context that I stand to say it's about time. It's about time that there is legislation in front of this place that provides for sick pay here in British Columbia. I suppose one could say to the Premier and to his colleagues, where the heck have you been? We are 14 months plus into this pandemic. Providing sick pay had been identified and has consistently been identified as one of the most significant tools that had not been embraced in this province, but that if and when embraced could make more of a difference than many other strategies and tools to address the transmission of COVID during this pandemic. And yet, 14 to 15 months into this pandemic, it is only today, here in May, that we are dealing with this legislation. And so while I support the merits of certainly the provisions in this bill that provide for the temporary sick pay during the pandemic, I'll have more to say about the other part of this bill, which I have more concerns about. But in terms of providing that sick pay during the pandemic, we've been calling for this for many, many months. We wrote the Premier back on May 27th, 2020, and in and amongst a series of other initiatives and actions that we were encouraging, urging, imploring the government to embrace, to put all of the tools on the table to combat COVID. We included in that list a very clear call for sick pay. The Premier not only had our support in moving forward at that time, but the Premier had the support of virtually every business organization across this province. Because as has been said many times, and I agree, a well thought out, reasonable sick pay program during the pandemic, one that takes into account the needs of employees as well as employers, is the right thing to do. And so that's why I'm glad that we're finally here talking about it in the context of this legislation today. The Premier, has stood in this House and has made many comments outside of this House. A year ago, where he said, we are prepared to go it alone, we are prepared to implement a plan. In fact, we have a plan ready to go. Those aren't my words, those are the Premier's words, and those were words that he uttered a year ago. Recently, he had an interesting choice of words where in this chamber he, in reference to a question about where is the sick pay legislation that was promised so long ago, he said, we are leading the way in the country. And yet it took 14 months and a year after promising to do it to actually see some legislation brought forward. Mr. Speaker, it is not lost on a lot of British Columbians. It's not lost on a lot of labor organizations. If you read the comments that are out there, even today, since this legislation was announced or introduced in this House, it's not lost on a lot of workers, a lot of small businesses, a lot of British Columbians that this temporary sick pay program should have been put in place a year ago. And I can't help but point back to the Premier's decision to call an election in the middle of this pandemic, which, among many other things, clearly had an impact on the timing of the introduction of temporary sick pay in this province. And so it's on the Premier, that a lot of British Columbians had to make that very difficult choice over this past year, that very difficult choice to choose between paying their bills or going to work sick. It's on the Premier. One will never know the extent to which the lack of action on this, as was promised and as was needed a year ago, one will never know the impact that has truly had on countless families and British Columbians and communities all over this province. One will never know how much the spread of COVID was able to accelerate because there was no introduction of this needed sick pay program a year ago. But it clearly has had an impact. The lack of action on this has had an impact on a heck of a lot of people. And Mr. Speaker, it's all of those British Columbians, those 50% of, approximate 50% of workers in this province that don't have sick pay benefits in their workplaces. So we're talking about a heck of a lot of women. We're talking about a lot of people of color. We're talking about a lot of youth, those 20 to 39-year-olds that the Premier likes to talk about. A lot of lower income workers that have been impacted by this and who need this to be in place. We're concerned that there are a tremendous number of details that are lacking in this bill and in the materials wrapped around the bill. For example, we'll get into more details in the committee stage on this bill, but we'll want to talk about a range of different provisions and regulations and consultation and other details which are largely unknown today. And again, the member from Shuswap spoke very eloquently about some of those concerns. The fact that consultation really hasn't taken place on what was introduced in this legislation. The fact that the Section 2 of this bill provides for the implementation of a permanent sick leave program as of January 2022 with absolutely no detail attached to that whatsoever. The WorkSafe BC reimbursement program, we're told it's in development. There's no details provided as to what that's going to look like, how it's going to work. There was an indication in some of the materials that it may take 30 days for WorkSafe to set up a system, a reimbursement system, an IT system. Again, no further details, no details around how this reimbursement program will actually work. How often will employers have to submit applications for reimbursement? How will those applications be adjudicated? How quickly will the reimbursements be turned around? How will the reimbursements be made to the small businesses? We don't know. There are no details included in any of this material. The bill says that employers can actually ask for reasonably sufficient proof from employees in relation to their absence. But there is also a clear statement that that does not mean a doctor's note. But that's it for detail. There's no explanation as to what reasonably sufficient proof means. A bit concerned that the government clearly hasn't done the work on the costing of this program. There's no, the minister and the premier trotted out a number, $300 million in their press conference, but if you actually read the transcript of that press conference, it's pretty hard to have much confidence that they have much confidence in that number. It's based on if all of the workers that don't in British Columbia that don't have access to sick pay were to take the full 3 days, it would add up to $300 million. But it hasn't been tested. There's no business plan for this. There's nothing that the government can or has pointed to clearly indicate how they've arrived at this number. I will say, though, back to my comment earlier about the 1-year delay in rolling this program or any program out. I mean, clearly it's going to cost the government less to implement a temporary sick pay program today than it would have a year ago or 9 months ago or 6 months ago. Maybe that was part of the government's calculation. If it was, I say shame on them. If that was part of the calculation in delaying, that's unacceptable. But the reality is the vaccination program is accelerating. We hear today that now over 50% of British Columbians eligible for their first vaccine have received that first dose. That's good news. We're seeing case numbers. The trends look good. The 7-day rolling average looks good. Hospitalizations and ICU numbers, there's room for more improvement, but the numbers look good. All of this is pointing to the transmission of the virus is slowing down. But a lot of people have paid the price, though, because they had to make that difficult choice to be sick at work or to go home and not be able to pay their bills. The impact on small business in particular is, I think, an important point of discussion here. And I hope that members on the other side in their subsequent comments will speak to it as well. There is no question that the Premier and the Labour Minister and others have echoed comments or have made comments similar to comments that we've made on this side of the House, and so far as concern for the thousands of struggling businesses that there are in British Columbia at the moment, and that these businesses just cannot sustain additional costs at this time. The government says that this program, this temporary program, is going to insulate employers from cost. That's not entirely true, 100%. I mean, just be honest about it in your communications. It will cover most of the cost for a good number of employers, but not the definitive, government's there for business, there for small business, and we recognize they struggle. They're struggling right now, and we're going to cover all the cost. The government is going to cover 3 days to $200 per day per worker. That's roughly an individual making about $25 an hour. But any employers that are paying workers above that, the employers are going to have to step up and cover that difference. And that might not be a huge, segment of the workplaces that we're talking about that will be most impacted by this legislation, but there are lots of businesses that will meet that test, and that will have to step up and pay these additional costs. So that's not really saying we're gonna be there for struggling small businesses and make sure that we're not layering another cost onto their shoulders. I'm also shocked that the government is going to implement a reimbursement program. Instead of dipping into using the $3.1 billion in contingencies that the government has and flattening a process here to ensure that the money gets directly into the hands of small businesses or businesses generally that need it, the government decides to set up a program through WorkSafe BC. The onus is on the business to incur the cost, have their cash flow impacted as a result at a time where we can, again, all acknowledge that businesses are struggling. Many are struggling. But we're going to say your cash flow is going to take a significant hit. But don't worry, you just have to submit your application or receipts or however that's going to work, because there's no details on that yet. You're going to submit it to government, and don't worry, we're going to reimburse you. I have no idea about how long it's going to take. And Mr. Speaker, I would have more confidence in a reimbursement program if this government had demonstrated competence in other programs that they have tripped over their own shoelaces on through this pandemic. And there are still British Columbians today that haven't received their $500 COVID recovery benefit. There are thousands of businesses that are still waiting to be approved for business recovery grants that this government announced last September. Latest estimates suggest that on that program, with money that was approved in March of 2020, a program that was announced in September of 2020, and we had an election, that today, a year plus later, maybe $200 million of $345 million that constitutes the business recovery grant program, maybe 200 of the $345 million is actually out the door. That's just ridiculous. And so now we're going to look, government's going to look small businesses in the eyes and say, trust us. We're going to do a good job at processing your applications quickly and ensuring that there's a speedy reimbursement on your application. I don't believe that it's going to happen. The government should be dipping into its contingencies here. And as I said, they should be implementing a program that is really flat, minimal red tape, and get the dollars out the door to businesses that qualify to cover the costs of these workers, of their workers, who rightfully so will utilize this program. Instead, this government's going to establish a reimbursement approach to it. Which brings me to the section 2 of this bill, which is the section that provides for the implementation of a permanent sick pay program as of January 2022. Lots of concerns with this piece. Again, not at the highest of levels from a principled perspective in recognizing the importance of sick pay during a pandemic, but the cleverness of this government to embed in this legislation here today, while we're in the midst of a pandemic, the third wave of a pandemic, and the goal should be to push money out the door as quickly as possible to cover these sick pay benefits during the pandemic, the government decides to roll into this bill in Section 2 a provision for permanent paid sick leave with no details. No details included in the bill. The cost of this, will it be borne by government? Will it be borne by business? We don't know. How many days will be involved? Are we talking about another couple days? Are we talking about a week? Are we talking about more? There's no indication of that either. How will consultation look like? Government makes a big deal about all the consultation they do, all the transparency that they ensure is in place. Read the comments in the news releases that business organizations have put out, and labor organizations too, just in the last few days. And while there's general agreement with the implementation, the need for implementation of paid sick pay during the pandemic, there's a lot of concern around what any permanent program would actually look like, what it would cost, who will pay for it, how will it be structured. And so instead of bringing forward separate legislation on that piece, bringing forward separate legislation to this House so that we can debate a permanent sick leave program, so that we can ask those tough questions of government, so that we can insist on costing, so that we can cross-check the government's thinking on this, get input from the official opposition, from the Green members in this House, from government members. Instead of doing that, they could even bring that legislation forward this coming fall, they embed it in this legislation with the details to be forthcoming in regulation. You know, Section 2 provides for the fleshing out of a permanent program by saying paid leave for up to the number of days prescribed and unpaid leaves for up to 3 days, and this is all done through regulation. And for those handful of viewers that are watching right now, what that means is there's no scrutiny. When regulations are developed, they're developed in the confines of the cabinet room. I've been there, I know how it works. There's no requirement to bring regulations, and it's not a protocol in practice, not how this place works. So the government's going to implement a permanent sick leave program, and they're going to come up with these details. They're going to presumably do it behind closed doors. They're not going to bring it forward into the People's House here so that we can have a thoughtful debate and discussion about it, challenge the government on it. I mean, they're going to win the vote anyway. They've got 57 seats. They're going to win the vote. But this is back to what many members of this House have talked about recently. This is about respecting the process of this legislature. And on something as fundamental as a permanent sick pay program, that should be coming to this place. It should not be developed and implemented via regulation. And I'm concerned about the process there. I'm frustrated that the government, as they often do, is linking a very critical issue that in the here and now that requires the attention and the focus of this place, and they're sliding in a back door, a critical program implementation where there won't be debate. Yes, I'm concerned about that. I'm also concerned about who the heck is going to pay for this. Is this going to truly be a program that's supported by government? Will it take on the same fashion of the program that the temporary program that we're also talking about here today, or is this going to be on the backs of business? Because again, the government has not got a great track record at not taking every opportunity they have to do these kinds of policy implementations on the backs of small business. You know, this is the government that made a great big deal about eliminating the MSP, half of which you know, had already been planned to be repealed. But they're collecting $1.9 billion now every year on in the employer's health tax on the backs of businesses, and a lot of small to mid-sized businesses. That's on top of the double dip here, the additional $1 billion that they were collecting in MSP premiums still before it's fully phased out. This is the same government that thought it made sense to increase British Columbia's corporate income tax rate from 11% to 12%, while other provinces and neighboring jurisdictions are lowering their corporate income tax rates. You know, Alberta is reducing theirs to 8%. Can't even compete with Washington State. It's about $5 billion of additional taxes that have been imposed on the backs of business in this province. All kinds of tax increases, new taxes, huge impact from additional regulations that business has to grapple with. I mean, we can't even get the government to not tax the air over the heads of small businesses as a permanent measure. I mean, how ridiculous is that? But it's just another burden, another cost burden that's layered on top of small business. And so, you know, and we don't even know if we'll be out of the third wave. Hopefully, we are, or into a fourth wave. We don't know where COVID's going either. So where are the provisions in this legislation with respect to a permanent sick leave program that take into account that we may have a ways to go here in terms of coming out of COVID and then restoring some sense of normalcy and really relaxing health restrictions that in part are having impose some significant challenges on businesses. There's a heck of a lot of businesses out there that are just not going to make it. They need help. Not provisions for a permanent sick leave program that nobody has any details about, that's just baked into legislation today that will come into effect at some point in early 2022. The government, you know, was asked in briefings on this legislation, is that a permanent program going to be on the backs of business, or will government be there to help business? And there was no answer. The government refused to answer that question. We'll be asking those questions again in committee stage. Mr. Speaker, there is a lot to be there is a lot to be appreciative of insofar as the temporary sick leave provisions of this legislation, that notwithstanding the flaws in terms of the reimbursement program and all these other, I think, very legitimate concerns that we have. So there's a lot to be appreciative about, and insofar as it's here today. It's arguably too little, too late. It's a year later than was promised, but it's here. But we're going to continue to do everything we possibly can to urge the government to make sure that this temporary program, that the application process, the reimbursement of costs has as minimal an impact on the cash flow and the operations of businesses and small businesses in particular as possible. And we're going to urge this government every step of the way to back off on this inclusion of a permanent sick leave program in this legislation here today. Let's take a step back on that piece. Let's do the proper consultation with employers, with business associations, with labor organizations and businesses, workers. Let's do that consultation. And let's have the government bring something back in its own standalone piece of legislation that we can debate in this House at some later date. Businesses need certainty. There's a lot to be uncertain about in this piece of legislation. I thank you for the opportunity to speak to it today.
Thank you, member. Recognizing Nelson Creston.
Hi, thank you very much, Speaker. And today I am so honored at the privilege of being able to speak in this House in support of Bill 13. And of course, Bill 13 is going to provide paid sick leave for workers across British Columbia. This is incredibly important legislation. As everyone knows, we are in the middle of a pandemic, and no worker should have to have the dilemma of going to work sick or being able to provide food for their families. And I know there's 50% of workers across our province have no paid sick leave whatsoever. So that means when they wake up with a tickle in their back of their throat or a sore stomach, that many of them just get up and go to work because they don't feel like they have the option. What we have seen, I think, with COVID-19 is, rewind, say, 2 years ago, and all of us knew that coworker that would come sick to work, and how uncomfortable that could make workers, because we all knew that put everyone that came into contact with that person at risk. But there was, this sort of cultural sense of, I'm not that sick. I can just get through it. My work's really important. I need to be there. But that also puts everyone else at risk. Now with COVID, we know that you're not just passing a runny nose around your office building or a cough, but instead you could potentially be impacting your workers so that your coworkers that you care about, that you could be getting them very sick and potentially dying. And no one, absolutely no person, wants to have that burden on them. But particularly for our low-income workers that are living paycheck to paycheck, having to skip a day of work means that the already incredibly tight budget that they all already on is stretched even further. What this incredibly important bill does is it provides that breathing room for people. So when they need to stay home and take care of their health, they're able to do that without losing money and without losing wages. And I think what's incredibly important is that we're not saying, okay, we're just going to be providing this for now because of the pandemic, but we're recognizing that this is really important for all workers to have that type of stability moving forward so that when they feel sick, they're able to stay home. And so I'm so grateful that we're not seeing this as, a temporary measure, but instead we're saying, okay, we know it's the pandemic, we're going to put it in place now, and then we're going to do consultation. We're going to be talking to business owners, we're going to be talking to unions, and of course we're going to be talking always to Indigenous people and figuring out the best way to move forward. I was just talking with a local business owner, and she has, a thriving small business in our region. And she told me that she was really happy to hear of this legislation coming forward, because that means that there's extra incentive for her employees to stay home when they're sick because they're going to be able to get paid. But it also means that she's going to be reimbursed for those for that money. And so this is a bill that is supporting workers and supporting businesses. And I know we are so fortunate, all of us, to live in British Columbia. And I'm so glad that we have been able to provide dollar for dollar more funding for businesses, more support for businesses through the pandemic than any other place in Canada. We are supporting businesses. We know that for many businesses, things are really tight. Times are very tricky. I know some businesses are just hanging on by a thread. But this type of legislation, what it means is that businesses, that workplaces are not going to become, those hotspots of transmission, because people, when they feel sick, they're going to be able to stay home and they're not having to make the decision of feeding their families or going to work. They're going to be able to stay home, take care of their health, and still feed their families. I am so grateful that we're going to be moving forward with this. And we know this type of legislation, it's going to be most impactful and most beneficial to low-wage workers and to many racialized people and to many young people. We know that a lot of those people, they do not have paid sick time with their employment. And a lot of these are also essential workers, and to think that essential workers aren't offered paid sick leave, how can that be possible? This is British Columbia. And of course, now we're saying, yes, workers are going to be getting paid sick leave. And I think that is especially important for those lower income and essential workers, so that they're able to keep themselves, their communities healthy and safe as they do the incredibly important work that they've been doing over these past 15 months. I'm just, and I just see this also as an opportunity. Really, this is going to be another piece that's going to be preventing transmission. In British Columbia, we have been, with the restrictions, but we've also seen, most businesses, there's a few exceptions, of course, like theaters, but most businesses have still been able to operate in some capacity. I know if you take a walk down our main street, there's patios all over the place. And if you go down there, you can see families, you can see couples really enjoying the wonderful, incredibly wonderful food that we have here and drinks that we have here in the Kootenays. And restaurants, it's been challenging for them, but they are still able to keep their doors open. We've been, you get takeout, or you can sit on a patio. And now you're also not going to worry if maybe your server is, maybe they're not feeling their best, because that server, those cooking staff, they're able to take time off. If they're feeling unwell, they're able to stay home. So we are going to reduce transmissions in the workplace because people are able to keep themselves, their coworkers, and their community safe with this legislation. So I just want to, again, I want to thank the Premier for his leadership on this. I want to thank the Minister and all of the ministry staff who worked hard on pulling this together so quickly, so that we're able to take one more step in supporting workers and supporting businesses in British Columbia. We all want to see the end of this pandemic, and that is one more step in the right direction. We also heard the fantastic news today that over 50% of British Columbians have received a dose of the vaccination against COVID. So that means that our levels of protection are increasing every single day. I'm the youngest member of the legislature, which will also likely mean I will be the very last person in the legislature to have the opportunity to receive their vaccination. But I am really, really looking forward for the opportunity. And this is funny because I absolutely hate needles. If you ask anyone, or my family, if you ask my little brother how he wants to bug me and drive me crazy, he starts talking about needles. Well, with the pandemic, I am absolutely so looking forward to the day that I'm able to get that needle in my arm, that day that I'm able to get vaccinated, so that I am further protective of myself, but also my family and my community. And this legislation is another piece of that. We are helping to protect our communities. We're helping to protect our workers as as the light of that end of the tunnel of the pandemic grows brighter. So again, thank you everyone who worked on this, and I'm thrilled to be able to speak in tremendous support of this bill. So thank you very much, Speaker.
Thank you, member. Recognizing Saanich North and the Islands.
Thank you, Mr. Speaker, and I'm pleased to rise today and speak to Bill 13, the Employment Standards Amendment Act number 2, 2021. And I'll comment on that in a few minutes here. I think it's important to get out of or to put on the record that it's our perspective that 3 days off is better than none. And so from that perspective, I think it's important to recognize the action that this bill is taking. However, 3 days off is not sufficient when it comes to addressing the challenges of the global pandemic COVID-19 has caused. That this proposal that's been put forward in this bill falls short of fixing the gaps in the federal program and means that many workers will continue to fall through the cracks. It's important to get on the record early in this in my comments that half measures will not solve the problem of workers having to choose between staying home when they're sick and facing possible financial devastation. We've heard already early in this debate, just the previous member talking about how no worker should have to go to work sick. That this bill and this action is going to prevent transmission, and that this is the type of bill that supports low-wage workers. It's important to acknowledge, Mr. Speaker, that we are 15 months into this pandemic. And if those statements are true today, then those statements were true 15 months ago. Meaning, the lack of action over those 15 months at the provincial government level has put British Columbians at risk of unnecessary transmission of COVID-19. And it's the cognitive dissonance of the members of government that want to stand up today and celebrate this act today and overlook the fact that it has been a significant amount, that there has been a significant amount of heel dragging to get us here. The reason why I thought it would be worthwhile to point out that this is the Employment Standards Amendment Act number 2 is because earlier in this session, we were debating the Employment Standards Act number 1. It didn't have a number 1 because it was just the Employment Standards Amendment Act. So here we are in this session, this spring session of government, of the government, where we have the budget and where we have a throne speech and all these things. And we have 2 Employment Standards Amendment Acts. What does that say about the level of coordination, the level of preparation, the level of planning that's going on the government's side of this House? That we have to have 2 Employment Standards Amendment Acts. And these are not for issues that could be deemed as unforeseen, Mr. Speaker. These are for issues that are very much part of the narrative that's been brought forward by advocates, by experts, that we need to put in place a paid sick leave program that's going to support workers to make the decision to stay at home, to decrease transmission rates in our communities. That we should put in place a measure that allows workers to step away from their job for a period of time to go and get a vaccine. Every time we raise an issue about COVID-19 these days, the government spin machine twists it to, oh, and by the way, we have 50% of British Columbians vaccinated. But that's not even true. What is true is that we have 50% of eligible adult British Columbians vaccinated. And that's an important distinction. That's an important distinction, because it is a remarkably different number if 50% of British Columbians were vaccinated than the numbers that are being put out there today. So when I hear the member previous speaking to this House previously suggest, and maybe a mistake, however, it's important to acknowledge that every time it pivots to the amount of vaccinations, it is a distraction from the fact that this government has already had 2 Employment Standards Amendment Acts in this legislature, that there was such a lack of coordination on behalf of the government that they couldn't put those 2 pieces of work together. In the context of the fact that, as was raised by the member from Shuswap, the Premier was out in the public, in front of the camera, in front of the microphone, saying, we got a plan, it's on the shelf, we're just advocating with the federal government, we hope that they're going to put in a plan to save us from having to do it and from having to spend from the provincial treasury to look after the business of the province. We're hoping that the feds step in. We got a plan. Except every indication that I have in this process to get this bill, from the fact that we've got 2 Employment Standards Amendment Acts this session, the fact that the information that we get is that this has been very much a harried process that gets us, that government is scrambling to get this in front of us as a response to an overwhelming call from British Columbians and an overwhelming call from people across the country on those provinces, including British Columbia, that does not have a paid sick leave program for people to help them make the decision to stay home when they're not feeling well. This was one of the first things that our Premier advocated for back in 2020 when we were responding to COVID-19. We need a paid sick leave program, and he said over and over and over again that he's advocating with the federal government to do that. So it's not like this is something new. So when I hear the members from the government side of the House celebrate this act today, it must be done in the context that if everything they say is true, that no worker should have to go to work sick, that this is going to prevent transmission, that this is going to support low-wage workers, if yesterday and every day previous back to March of 2020. And every day that we have not had that option in front of British Columbia, that support for British Columbians, that they were made aware of it, is a day that put people, vulnerable people, people who didn't necessarily have the financial means to take a day off to stop themselves from getting sick, we put them at risk. This government put them at risk of that transmission, and that is entirely and completely unacceptable. And it's important that we call out the cognitive dissonance that we hear in the speeches already in the early part of this debate, and we put a name to it, because it's not acceptable. Celebrate the second Employment Standards Amendment Act of this session. Celebrate it, if you will. That's fine. It's a good step, and it's one that we've been waiting for. But don't celebrate it like it's some kind of superhero coming in to save us from this, because in fact it is actually too little and pretty late. Especially since in question period this afternoon, the Premier stands up and is talking about how we're nearing the end of the pandemic. If that is in fact the case, why is this being brought forward now? So let's put some context around what it is that we're doing here today. We are scrambling to a finish line that was established by the public who demanded this action. And it was only the demands of the public, and it was only the demands of the advocates, and it was only the demands of people like the BC Federation of Labour, who were demanding this program be put in place, that finally got this reluctant government to stop dragging its heels and put something in front of us. And what is in front of us falls far short. Laird Cronk from the BC Federation of Labour says, quote, "It never made sense for workers to go to work sick. Permanent, paid sick leave protects workers and their co-workers, strengthens public health, and ensures economic resiliency at the same time. Workers struggling with a COVID-19 illness face far greater than 3 days of lost pay. They face potential economic devastation." That's Laird Cronk, BC Federation of Labour. He goes on, he says, "Ensuring workers don't have to make the untenable decision between staying home with symptoms or working sick to put food on the table and to pay the rent is critical during this deadly race between variants and vaccines," end quote. And I'll just pause here for a second, because it's only the vaccines that this government wants to talk about. They're not talking about the variants anymore. Thankfully, Mr. Cronk raises the issue of the variants, because this government doesn't want to talk about them anymore. We're only talking about the vaccines. Mr. Cronk continues, "COVID-19 is not going away after 3 days." And this is the advocacy that 3 days of paid sick leave as a bridge doesn't nearly go far enough. Even at this late date, it is far less than what is needed. For 15 months, workers have been having to make the choice. 15 months, workers have been having to make the choice that the members from the government side of the House are celebrating today, that when this bill passes, they won't have to make that decision anymore. We're going to help them out. It's worth noting that this is an NDP majority government that is putting this bill forward, and it's completely way off the mark. Another quote, Paul Finch, treasurer of the BCGEU, tweeted, "This government was elected with a majority to provide the supports working people need to make it through this pandemic. Mimicking the Ford government's quota on paid 6 days a year late doesn't just fall short of the mark, it misses it entirely." Talking about Ford government. It's the government of Ontario, whose 3-day paid sick leave was panned, and who yesterday, I guess, the great distinction that our Premier wanted to draw between our paid sick leave, which is dramatically better, and the Ontario paid sick leave, was that theirs ends in September and ours goes all the way to December. But other than that, pretty close to being the same. You know, Andrea Horvath, leader of the Ontario NDP, talking about that Ford government plan in Ontario, she said, quote, "Offering people a pathetically inadequate 3 paid sick days is not good enough, especially not during a global pandemic that makes people sick for at least 14 days, which is 4 days more than what the BC Federation of Labour is advocating for with a 10-day paid sick leave program." While the NDP has been waiting for the feds to step in, people have been getting sick and dying from COVID-19. The foot dragging by this government is completely unacceptable. We've needed, for all those 14 months, for every day and every month since COVID-19 hit, we've needed a government that's been ready to act and do the things that are necessary to stop this pandemic and to protect British Columbians. But we've been missing that boat for 14 months. Okay, I'll give credit that our Premier did say it first, that we needed a paid sick leave program. But that's where the credit ends, because he had no follow-through. None at all. Even when he had the majority government that he craved so bad last fall. For the last 8 months, he's had this majority government. We sat in here in December. We sat in here in March. We sat in here in April. We've put Employment Standard Amendments Acts up previously. Nothing about paid sick leave. Only after the public demanded this government do something, because the experts were saying this was a needed step in order to stop the community transmission, the transmission in the workplaces. Only after this government took the last week or so to debate how they were going to deal with this when we were doing our constituency week, we finally see this bill now in May of 2021, 15 months later. So this province has long needed permanent solutions that provide paid sick days to everybody. Right now, only about half of the workers get paid sick leave, sick days. Disproportionately lower income, racialized workers do not receive this benefit, and they're paying with their health, Mr. Speaker. COVID-19 has shown the need for all workers to have the ability to stay home when they're not feeling well. We've seen the danger when that provision is not made available to British Columbians. CBC journalist Justin McElroy tweeted today, quote, "New community debt level data just released by the BC government continues to show the positivity rate above 20% in many of the poorer and less white areas of Surrey." That's who this government has been ignoring. Racialized community neighborhoods, less well-off neighborhoods, those who face poverty, those who cannot afford to make the decision to stay home because they need to pay the bills, because they need to put food on the table for their kids and family members. Those are the most vulnerable people, are the ones that for the last 14 months this government has ignored. That's not acceptable, Mr. Speaker. These are frontline, low-paid workers. These are the people that we rely on in our society. No support. Lots of talk, lots of disappointment in the Prime Minister. So disappointed. But yet not willing to acknowledge the lack of action that's been done up until this second employment. We are ignoring the most vulnerable people, and these are also actually as well the least protected people as well, because these are also folks who up until very recently have not been eligible for a vaccine, despite the calls from people in our communities asking for vaccinations for frontline workers. We had an age-based program. The vaccination program in the most recent weeks, the government's been scrambling out different variations of the vaccination program with very, very poor communications about it. So these are not only are they folks that can least afford to take the day off because of an illness, they're also the people that are least likely to have been vaccinated now. And that just makes the whole situation even more uncomfortable, doesn't it? We stand here in this place, don't we feel uncomfortable about that? Instead, we have a tone from members of government of celebration and a celebratory tone. I feel kind of uncomfortable that I can stand here in this place and say these words and they be the truth of the matter. That should make all 87 members of this place feel just a little out of sorts, I would think, knowing what we've known, knowing what our Premier has known, and yet, rather than actually do something, use the power that is bestowed in the members of that side of the House to actually put in place a program earlier than 15 months late. This government and this Premier has instead engaged in this rather kind of really unfortunate game of chicken with the federal government, saying, well, you know, you're going to do it or I'm going to do it. It was unfortunate to see that it wasn't in their budget, and it's not in our budget, it's in nobody, it's there, they're going to do. British Columbians lose confidence in their government when they see the elected leaders of their communities posturing like we've seen the Premier posturing with the Prime Minister on this matter. What British Columbians want when they elect a government, and when the Premier stands up with all the bluster in question period today, that's why we're on this side of the House and you're on that side of the House. When the people of British Columbia give a majority, the blessing of a majority government to a Premier and to a cabinet, they don't expect them to play games with the federal government. They don't expect the posturing. They expect leadership. That's what was promised in the fall of 2020. Leadership. We need this majority government so we can lead without all the distractions of the junior partner, without all the distractions of a minority situation. The House might fall this day or that day. We don't want those distractions. What we want is a majority government to lead this province through this COVID-19 pandemic public health crisis. Instead, we get, 15 months later, a bill that doesn't go far enough to support the very most vulnerable people in our society. And in addition to that, we get the government giving themselves, using the same bill to open up the ability to give themselves the ability to put a permanent paid sick day program in place through regulation. Now, I said earlier that we believe that there needs to be a paid sick day program for all in this province. That's the position that we take. That's what we believe. So why would I then be frustrated about the fact that the government is opening up the ability for them to then do that through regulation? There's a number of reasons why. First of all, there's no accountability and no debate that happens about that program. It's not a public process. It's a private process that gets done through cabinet. And as well, and this should be the point that I think the BC Federation of Labour and the labour leaders in this province need to pay very, very, very close attention to, because of the political environment of this province. When those days are put in regulation, they don't require legislation to change them. So just as we can celebrate all these days of a permanent program, perhaps starting in January 2022, perhaps, it's not been done yet, the consultation's still to go. If the government falls and there's a new government in place, the exact same act that put those days in place is the same as the act that can remove those days. So why would we think that there's going to be anything else that's happened in this province than what has happened in this province in the past, which is that pendulum that swings back and forth. One government doing one thing, next government changing it. And then it swings back and forth. What we need is we need stability. Businesses need stability. Employers need stability. There needs to be stability in this House. That is why it needs to be done through the legislative process and not through regulations. Because through the legislative process, it has to happen in public, there has to be debate, and there has to be a process similar to the one that we're putting in place and going through right now for this bill, which with a lot of certainty is going to pass because the NDP has the majority. But at the very least, we get to stand and talk about the important issues that are impacting British Columbians, the important issues that are going to impact business owners, entrepreneurs, people who have invested their livelihoods into their business, the issues that are going to impact labor organizations around the province. So for me, Mr. Speaker, Section 2 of this bill provides none of that certainty. Yes, it does give the government the blank check that they'd so love to have to be able to regulate this paid sick leave through regulation. They can pick whatever number they want. But it should not be celebrated too vociferously when that happens. Because at any time, the government could change that using exactly the same tools that they used to set it. And I think that in the consultation process, I think labor leaders need to be really clear. And of course, they will advise government however they advise government. But my advice is we need to have this done through legislation so that whatever it is that is done has the ability to create certainty. Whether we love the decision or not, at the very least, there will be certainty and people can then plan their investments and their next actions on that. So as I wrap up here, Mr. Speaker, I just want to say that despite the Premier's promises last summer that there was a plan on the shelf that could be dusted off and rolled out when the federal government let us down, that is not the case. There wasn't a plan. The government scrambled to this day for us to debate this. They put together a plan that was a program that fell far short of what's needed to support workers. Far too little, far too late. And then also have given themselves the ability to regulate a permanent program which doesn't create the level of certainty that is going to be needed for both the employer and the employee, as it's left up to the whim of whoever it is that's taking up the seats of the executive in this province. And so with that, Mr. Speaker, I think it's important to be clear here. 3 days is better than no days, but it is far from adequate to provide the people that they need, the time that they need to be tested and to recover if they have the unfortunate positive test of COVID-19 to recover. It provides a bridge, but barely. And this is certainly not as organized, nor should it be as celebrated as I've heard in the content of some of these speeches, knowing just the level of vulnerability that this government has accepted, the lack of action has created. It should be a somber day in this place, that we're finally here, that we're finally doing this work that should have been done a long time ago. Because a lot of people have contracted COVID in the time that this House has not put this bill forward. Many people have passed away in that time. Many people have lost loved ones. And so I think it needs to be done in that context. Mr. Speaker, half measures will not solve the problems of workers having to choose between staying home when they're sick and facing possible financial devastation. And so what we need from this government is to put forward a plan that does accommodate the needs of those workers and that does respect the needs of the business owners and that is a truly collaborative process, not something that we're scrambling to this day and that obviously has not been well thought through. With that, thank you, Mr. Speaker, for this opportunity to speak to Bill 13.
Thank you, member. Recognizing the member for Chilliwack.
Thank you, Mr. Speaker. Once again, we meet again. It's a pleasure to speak in front of you as always. It is a real pleasure for me to speak to this bill. No worker should have to choose between going to work sick or losing pay. It's an awful choice. And I'm really proud to speak to this bill because I was a worker. Now I'm an MLA. I guess I sort of do work, but I'm not part of the working class anymore. And my family is, and so I really appreciate this bill, and I had to take the opportunity to speak to it. I probably won't be that long. I'm sure you're happy with that, but I thought I'd speak to this bill. I was listening intently to the member before me's arguments there, and normally I love criticizing the BC Liberal Party, and that's usually my shtick, but I thought I would give somewhat of a critique to his arguments. I found it odd that at one point he complains that we have to amend an act twice. Heaven forbid we pass legislation in this House. And then in the second stroke, he complains that this bill also will require regulation to institute long-term pay. So I thought maybe he could make his mind up on that score. That was my main critique, other than I think he's right. I think the Premier should not go, that's why we're on this side of the House and you're on that side of the House. I think the Premier should point out that a whole bunch of us sit on this side of the House too. We wrap around the place. Just like, when he's talking about the approaches that different parties have taken, the positions that different parties have taken, and who British Columbians have chosen as their representatives and for the government. So when I used to, swing hammers and pull wrenches, Mr. Speaker, I did have a non-union job where I did not get sick pay. And it was definitely a choice of whether, I could pay my mortgage that month or I could miss a week of work. And so I worked sick. Then I'd make all my coworkers sick. This bill is going to help to alleviate that. It's also crucial that we're doing it during COVID so that workers aren't going to work with COVID. It's also, in many cases, these are frontline workers, essential service workers who don't get paid sick leave. So this is crucial for them as well. And I'm really happy about that. Now, last time I was in this House, I made some comments about workers, and I kind of riled up the member from Kelowna Mission, and I feel bad about that because I'd like to, be friends with everyone in here and be friendly, and she's a great speaker. But I find it a little bit rich when other parties are coming in here, wrapping themselves in the flag of the working class when, the devastation they wrought on the working class. But I have a quote from the member from Kelowna Mission. She says, "I'm going to start with a story. The story is hopefully to allow the member for Chilliwack to understand how much the members on this side of the House actually understand workers." And she did. She made me realize how much this side of the House understands workers. And that's probably not good for this side of the House, in all honesty. She goes on to say, her daughter asked her what she does for a living, and she says, "In that moment, with tears in my eyes, I looked at her and I said, every day I go to work and I feed hundreds of families because I sign paychecks." Well, Mr. Speaker, they feed their families through their labor. And signing paychecks for workers is about the bare minimum you can do for workers. Essentially, you're paying your bills. Congratulations. It just made me realize how this side of the House views workers. And as paupers in workhouses, I guess, and that they're the benefactors for them, I don't understand it. There's also one other point. Maybe I have to one other issue I would have there. The member's the critic for health, and she, because I had mentioned the privatization of housekeeping staff, et cetera, in the health authorities, in the hospitals, and she mentioned it was such a great thing because they saved so much money they were able to buy new equipment, et cetera. I mean, sure, instead of funding healthcare adequately, privatize contracts and do it off the backs of workers, in most cases racialized and women workers. I mean, bully for you. That doesn't seem like a very very good thing to be proud of, in my opinion, Mr. Speaker. But I think this is a great bill, you know. I'm especially proud that we are creating a permanent system to begin on January 1st. And I'm very proud that we're going to do such extensive consultation with the community, with business leaders, with workers, to come up with a good system of a permanent paid sick leave. And I can't tell you how great this is. And you know, we'll consult with stakeholders to develop a model that's fair, reasonable, and works for everyone in BC. You know, I mean, I feel bad, sort of. I have another friend from the BC Liberals here, and I really enjoy her, and I feel sad that I'm doing this to you folks while I'm talking. Anyway, the BC Liberals also, during the years when they were in opposition, the minimum wage remained stagnant, including a decade-long freeze, and it resulted in our province having among the lowest minimum wages in Canada. And the approach that we take on this side of the House is we are increasing the minimum wage to $15.20 per hour on June 1st, and are getting rid of the lower minimum wage for servers. I think this is a great thing that the BC NDP is doing, and it shows the difference in approach we have. And it is, you know, why we're bringing this bill forward now. We have an approach where we care about workers and labor. And I don't have a heck of a lot more, Mr. Speaker. I just wanted to speak a little bit, a short period of time, and I knew that I had to say something about this bill. So I would hope that my colleagues everywhere in this House support the bill and show that they care about workers. Thank you.
Thank you, member. Recognizing the member for West Vancouver, Capilano.
Thank you, Mr. Speaker. Well, that is a hard act to follow, I must say. I'm pleased to rise in the House today to speak to Bill 13, the Employment Standards Amendment Act. I think everybody, regardless of where in this House they sit, agrees that we need to have paid sick leave to support workers when they are sick, so they are not coming to work and spreading COVID and worrying about having to make that decision. There's absolutely no doubt that we all agree on that same thing. And I'm very pleased to see that this bill has come forward. But I am very disappointed that this bill didn't come forward much sooner, and that I am very surprised that the member previous and other speakers on the other side of the House seem to think 3 days is some amazing gift that they are giving. It is absolutely the least that they could possibly be doing, and it certainly is not adequate for what is needed. But the timing of this is just astounding. A year ago, prior to me being elected, when I had a different life and I was running an organization, the first thing we did when the orders came in and when we realized that there was a pandemic and we had to do something in the office, the first thing we did is brought our executive team together and say, how, in our nonprofit, how are we going to support people so that they don't have to come to work sick? This was a year ago. This was us outside thinking, this is a no-brainer, man. We have got to do this. And this government said it's a no-brainer and they've got to do it, but they didn't do it. And I today find it stunning, and I think that the other side of the House should be embarrassed that it has taken this long and it is this inadequate. Thank you. I also must say I am offended by the previous member. I know what it's like to have to choose between going to work and being sick because I spent much time as a young person working in a minimum wage job, not a strong education, really trying to make my way. Luckily, I wasn't supporting anybody else, but boy, those were tough times. And I've also been in a position where I ran a small business, and if you say to me I did not care about my employees and the people that worked with me, there would be times small business people go without their own paychecks sometimes to make sure that their employees get paid. And if you look at people that run businesses and look at people on this side of the house, like they don't understand and they don't care about employees, I'm just very, very offended by that. So I am pleased to see something here, but it's got to be bigger and it's got to be better than this. And there are two pieces to this. So we are talking, I got kind of off track at the beginning because of my emotions there. There's two pieces to this. There is the 3-day pandemic pay, but the second piece is this ubiquitous permanent pay that we need to talk about. But one thing, and I might be misinterpreting this, and I'm sure government has taken this into consideration, but my understanding is that if an employer already provides sick time and pays sick time the same or in excess of what would be applicable under this, what would be the 3 days, that this amendment does not impact them. Again, full disclosure, I might be misinterpreting this, but I believe that is what the legislation is saying. So if that is in fact the case, I have two concerns with that. We were a nonprofit organization. We did the best we could to be able to provide paid sick time. We provided paid sick time. I've always, as an employer, provided paid sick time. So if an employer who offers this, they in some way are being penalized for providing, let's say, 6 days paid time, if now another employer is providing 3 days and they're getting that paid for. So just to, there's never always a best solution to this, but I just want to make sure that we're not punishing or penalizing an employer who is providing sick time. And perhaps they should now also be able to have those 3 days reimbursed if employees are using those for COVID illness purposes. Alternatively, employers or employees who have currently 6 paid sick days, if they are now expected to draw on those 6 days, 3 of those 6 days for their COVID illness, they are now losing a benefit that they already have. So again, just a consideration as this moves forward is that they then should have an additional 3 days to ensure that they're not losing anything and they're back where they started. So, but as I say, I am sure that that has been considered. The reimbursement is a concern. This is yet again something that an employer is going to have to apply for. We have seen with the application programs for grants and other benefits that this government has rolled out in the last year, that it's not always easy to get a reimbursement. It takes time. And it is a very difficult time for employers right now. So if they are having to pay something up front and wait for a period of time to get reimbursed, it is just yet another financial burden that they have. I'll just pause to see where do I want to go next, and in what order do I want to talk about these things? We'll talk about the permanent paid sick leave. So putting something into regulation as opposed to putting it into legislation is lazy. It is simply lazy. You don't want to do the work now. You don't want to come and talk about it. And you're just going to put it away and deal with it later. And whoever is going to be impacted is going to be impacted. That is something that should be determined. There is time. This bill doesn't all have to come through right now. We can do this in two pieces. We have the fall to come back. This doesn't come into effect until 2022. Let me tell you that when I ran a previous organization, the one I was referring to earlier, and the BC Liberals had said, we are going to reduce the MSP by 50% next year, we thought, oh my gosh, that's fabulous, because we did pay the MSP for our employees. That was just going to be wonderful for us. But then the NDP government came in, and they said, we're going to get rid of the MSP. And I thought, that is fabulous. We're very excited that they were going to get rid of the MSP. And then they introduced the employer's health tax. Now, it's not that they introduced the employer's health tax. It's just that they didn't explain what it was or how it was going to impact us. So my board, myself, my team, we didn't know what the impact was going to be to our organization. We didn't know how much it was going to cost us. And then we had to pay the MSP and the EHT at the same time. The reason I'm talking about this is because I really do want to demonstrate that when you put uncertainty where a business or an organization doesn't know what's going to happen, it's very problematic. And there's a bit of a paralysis in terms of what we can do and what we can't do, what's going to cost, can I hire somebody else, is this? And it was months before months and months after we already had our budget, that we actually knew what the rules were on EHT for our organization. So this is going to be the same thing. You're saying, hey, we got something that's going to probably cost you money, might not cost you money. We're not sure if it's going to cost you money, how much it is, but don't worry about it, because we're just going to decide in regulation, and you know, you're just going to have to roll with it. Putting something in regulation, it's inexplicable. You go to the legislation, it tells you about overtime. It tells you how to, calculate vacation pay. It tells you all these other things. So why would this be treated any differently? I don't understand. It makes no sense. Businesses and nonprofits are stressed enough about this. So I really, really am glad to see that we have got something moving forward, but I am very disappointed, and if this is the government of the people, as the member previous was saying, and really cares about workers, and really cares about supporting people in these difficult times, there is no excuse for this having not been brought forward earlier, and there is no excuse for it being as light as it is now. When you have got someone who is sick with COVID, or thinking that they are and needing to kind of get that figured out, 3 days is nothing. It's embarrassing. And what about all of those people who in the last year, in this whole period of time where there could have actually been sick days in place, what about them? Is this going to be retroactive? What about the employers that have already paid out that sick time for people? Is it going to be reimbursed now? We knew it was an issue. And think about, think about the impact that this has had to people and communities, to workers and to their families by this not having come in a year ago when it was promised. People went to work sick. They made people sick. People could have died because they had to go to work, and this could have been fixed a year ago. And it's not like this government did not know that was going to be an issue. It was the first thing that my team thought of when we knew there was a pandemic. So I find it just shocking that everyone I'm listening to on the other side of the House is patting themselves on the back and saying, hooray for us, we're doing this great thing. Well, it's not a great thing, it's an okay thing, and it's a lot too late. So I shall now take my seat, Mr. Speaker. Thank you.
Thank you, member. I will give one more opportunity for speakers to this bill. I understood there was one more speaker that wanted to address this bill, but I don't. Oh, and there he,
Mr. Speaker, Columbia River Revelstoke.
There he is, member for Columbia River Revelstoke. Welcome. Good to see you, member.
Well, thank you, Mr. Speaker. It's always a pleasure to see you. And it's always a pleasure for myself to rise in this House to speak on behalf of the hardworking women and men in the riding of Columbia River Revelstoke that I represent. And today, of course, speak to Bill 13, the Employment Standards Amendment Act number 2. Bill 13 and what it means to workers is, as it's already been stated, is long overdue. And I'm absolutely pleased to see that this Premier has finally recognized the need for this bill to come into place during these incredibly difficult pandemic times. This bill does represent a vital tool that we need to help flatten the curve and prevent the spread of COVID-19. And it's a real shame that it's taken us this long. And I'll reference this several times as I go forward. But thinking about we've been into this pandemic now for 15 months, it's really, frankly, a shock that it's here in May. But nonetheless, we continue. And frankly, it's about the time that this Premier delivered on sick pay during this pandemic, as I've mentioned already. And a measure and an action that on this side of the House, we called for over a year. Over a year ago, we suggested this in a letter, and crickets. There's no question that paid sick leave is a vital tool that we need to flatten the curve of COVID-19, as well as known as that outside of parties and social gatherings. The workplace is one of the highest spreaders of COVID-19. So it's important to recognize that. British Columbians need to be able to safely and confidently abide by health guidelines. We're constantly told you got to step up and do your part, and British Columbians have done that, and stay home if they're displaying any COVID symptoms. But no British Columbian should ever feel like they have to choose between being unable to pay their bills or support their families or going to work sick. That fear had to be removed. Mr. Speaker, the timing is everything, they say, and this government tabling this legislation more than a year into the pandemic, more than a year after the Premier promised this to British Columbia, it does seem too little too late. But I don't want you to take my word for it, Mr. Speaker. Laird Cronk, who's the president of the BC Federation of Labour, said, and I quote, 3 days covered by the province won't be enough to protect low-wage workers who are disproportionately women and people of color. He also said that workers struggling with COVID-19 illnesses face far greater than 3 days of lost pay. They face potential economic devastation. Mr. Speaker, it's completely unfair to the thousands of families who have been forced to make difficult decisions throughout the 15 months. Disproportionately women, people of color, youth 20 to 39 without coverage, that we're counting on this during the second and now the third waves. It's been too long in coming. British Columbians should not have had to wait for so long, considering we first brought this issue of paid sick leave program to the government's attention. We addressed it on May 27th, a letter to the Premier regarding small business supports almost a year ago. And what are the results of their dithering? Because they do that a whole bunch. Well, let's look at what the member from Shuswap and the Labour Critic had to say about this, and I quote, "You have to ask yourself how many COVID transmissions actually happened in the workplace because of the failure and delay of government-funded sick leave program being made available." We'll never know. We'll never know what impact that had. We won't. But certainly it had an impact, and it's a shame that people had to get sick because of it. By the time this bill passes, it will likely be June before anyone is eligible for the provincial sick pay. What is even more concerning about this bill is that it hasn't outlined many of the provisions, regulations, and consultation that such a bill requires, and that most likely won't be in place even after the bill is granted royal assent. Consultation. It is fact that paid sick leave has the potential to be the single largest cost to business in the upcoming year. And in spite of that knowledge, this government has not conducted the appropriate public consultation before tabling this bill. Instead, we see more work done behind closed doors from a government displaying a worrying lack of transparency. Where is the consultation in this? Where is the consultation with businesses? Where's the consultation with employers? This has become a pattern of this government. Let's just do things and just move on. The operation of this program has been downloaded to WorkSafe BC, I should say. Yet this government has not yet set up a WorkSafe BC reimbursement program for employers and businesses. They haven't done that yet. It's the same old, ready, fire, aim from this premier. Mr. Speaker, success requires a plan, and these guys don't plan. And now employers with limited cash flow will have to pay out money, apply to be reimbursed for the government for up to $200 a day, and it will be on the hook for the rest. In the place that I live, Mr. Speaker, businesses are hanging on by a thread, and they're trying to keep their employees employed as best as they can. Even reimbursement of $200 a day, it's about cash flow, and I don't think with all due respect, a lot of those members don't understand the concept of cash flow. Is that without cash flow, you're not going to be able to pay anybody. So that money's got to come out of their pockets, and then they've got to apply to get the $200 a day back. And we know how good that this government has been in dishing out the cash that they promised. I mean, thousands of people still waiting for their COVID-19 relief fund checks. So for a small business where I live, this is very, very worrisome. The government has also indicated that a minimum consultation has occurred with businesses and employers, and that this is set to take place after the bill is law. This seems very odd to me as a former business person myself, considering that this government has had over a year to do consultation, but chose not to. Chose not to. I don't know why, but they chose not to. Many businesses will be on the hook for costs associated with this legislation, even if temporarily. And again, they will not even be able to consult with government until the legislation has passed. This bill also outlines the employers can ask for a reasonably sufficient proof from employees. But the Premier has failed to specify what qualifies as reasonable proof. So what is it that we're supposed to guess as small business owners? What does that mean? Are we supposed to just guess? No consistency. Mr. Speaker, how can you win a battle without a plan? And there is no planning when it comes to this government. The Premier and the Labour ministers continue to admit that struggling BC businesses cannot afford any additional costs placed on their shoulders. Yet there is still potential for additional costs to be downloaded onto this business in this legislation. Bill 13 sets out government remuneration at a maximum of 3 days up to $200 per day. Employers paying workers in excess of $200 daily cap will be required to pay that overage at their expense. Expenses that they can't afford right now. This bill still has a temporary sick pay measures, but there's no clarity about what will happen in January 2022, leaving the possibility for employers and businesses to be burdened with the cost of mandatory sick pay program at a later date. It's important to underscore that this measure is critical for workers. It's always about the workers. When I ran my small business, it was always about my workers and my family, their families, always, first of all, foremost. And that has to be at the forefront, but there is no clarification of contingency supports for businesses should COVID extend beyond January 2022. Uncertainty is not acceptable. More smoke and mirrors. The government will oppose this program by regulation, and the discussions will be held behind closed doors. This is an affront, Mr. Speaker, to the democratic process. My colleagues have talked about, why not put this into legislation? While we're happy to see British Columbians are finally getting access to paid sick leave, we are concerned as to why government attached Section 2 to this bill at this time, rather than introduce it to a separate piece of legislation and grant it appropriate room for debate and consultation. And that's the big debate here. What's the rush? The first part of this bill is incredibly important. We got to get it out the door. No question about that. But what's the rush on the Section 2? Why not wait for the fall, make it a legislated act, so that it can be debated and it can be fleshed out, and so it actually works for British Columbia. It's not just for the government. Forcing Section 2 is unnecessary and does not allow the democratic process to encourage proper consultation. And that is critical. We have to have that consultation. The government needs to understand that in order to undertake comprehensive consultation, they need to bring forward a bill during this fall session that provides more clarity to the business community and an opportunity for fulsome debate in this legislature. That's why we're hired to do. We're hired to represent our constituents and debate these things, not have it rammed through a regulation. Mr. Speaker, can I say that? What is the rush on this section? Why is that so important right now? British Columbians deserve sick pay during a pandemic, and they are finally going to get it. That's good, as I've already mentioned. British Columbians also deserve a government that is open and honest and transparent, qualities that this current government seems to avoid every chance they get. So I'm really looking forward to, Mr. Speaker, to seeing this in committee stage and really having a look at Section 2. So thank you very much, Mr. Speaker.
Thank you, member. Recognizing the member for Caribou-Chilcotin.
Thank you, Mr. Speaker. I wanted to respond to some of the earlier comments. I enjoyed listening to the member from Chilliwack, but I was unclear. He certainly comes across as though he's attacking the BC Liberals, but to me it seemed a little bit unclear because it seemed to me it was an attack on small business. I can assure you that myself as a small business person and an employer in the past has always cared for the people that I worked with, and certainly worked very hard to work with those people to the end, which was trying to obviously provide services to our community. But the other thing I did as a small business person was I paid a lot of taxes that I collected for this province. I paid a lot of wages, which of course were also taxed. And I think that some of the members forget. It's certainly all right to come after us. We have thick skin for sure, and we're here to represent our ridings, but that also represents small business in this province as well. I am thankful for the opportunity to discuss the bill. I want to share my thoughts on Bill 13, the Employment Standards Amendment Act. I'll support the first section of Bill 13 and really would ask what has taken so long to get the bill to this House, just like many of the members have asked. This was help for the people of this province, and it's taken 15 months to get to this point. It's certainly not a new need, and I'm glad to support this portion of the bill. I do have many questions and comments to make around the content of the bill, specifically questions about the decisions that will have to be made in the new year as to the amendment and it continuing into the future and the possibilities of this becoming permanent. I'm unclear what the decision will be and how long it will affect small businesses and how it will affect small businesses and the workforce in general going forward. The intent is not clear to me from reading the bill. I would seek more clarity on this point for certain. The amendment will create a mandatory provision to provide up to 3 days of paid sick leave for employees that have been employed for more than 90 days, which of course, it sounds like we all support. I understand that this will be a temporary provision though until the end of 2021. I'd like to add a couple of comments to the debate with respect to this bill. First, I'd like to make a plea for small businesses. I can't help but think that small businesses have struggled so desperately for almost 2 years, and everybody in this place would recognize that. Some of them far worse than others. Some of these businesses have tried so hard to change the way that they do things. Mr. Speaker, they've suffered through public health orders that have been well beyond their control. In the case of restaurants, not only have they struggled through orders, but they have had, in many cases, particularly in the interior and north, have had to compete against weather. And in some cases, they simply do not have areas attached to their establishments for outdoor dining. Movie theaters in my riding are selling popcorn and mini donuts to stay alive, Mr. Speaker. And as good as those donuts are, it's not going to keep them alive. Gyms in my riding also have tried to keep afloat, reinventing the way they do things. And now that it's a little warmer, they're trying to operate outside. Guide outfitters, tourism operators, just as we approach the season when they all should be busy, are now faced with travel bans, which have been devastating to all of these businesses. Mr. Speaker, it is a trying time for all of us, but for small businesses throughout this province, it is quite frankly frightening. What's worse, Mr. Speaker, is that the funding for these small businesses with respect to the support that the province has tried to offer them has been an absolute disaster. While Bill 13 will create another cost for businesses and another application to fill out, which of course is a cost in time as well, we still have so many businesses that have been unable to obtain funding. So many businesses that have applied for funding and for whatever reason simply do not qualify, or the funding has simply been delayed. As you know, Mr. Speaker, this delay, along with the struggle through the pandemic, has spelled the end for very many small businesses in this province. The idea that all of this has been happening for the last 15 or so months to these businesses, and that the government continues to put up roadblocks for funding and creating at almost every corner another cost to be absorbed by small business, it really is too much for so many of these businesses to bear. I know the feeling from this government. I know the feeling from the members opposite, that small businesses of this province seem to be the never-ending well of funds that they can take from and continue to add burden to. But Mr. Speaker, this well is running dry. It's not only public orders that have small businesses struggling, but also bills like this one being introduced to this House that continue to cost them. They will soon be providing paid time off for employees to receive their vaccine. They're now paying the employer's health tax. And now, of course, they're going to pay for sick time also. Now, I do understand that there's a provision for an employer to claim these funds back from the government, which I'm sure will not be quite as smooth as we generally hear it to be. How could it be? Nothing that I have seen introduced here in the last months has been smooth. I'm sure that many businesses have given up trying to receive funds from this government. And I would suggest that many will simply try to absorb this cost rather than go through a complicated application. Rather than going through the headache of trying to fill out whatever new questionnaires and applications will be required to receive this funding back. But I can assure you, Mr. Speaker, from what I have seen in attempting to help constituents with the BC Business Recovery Benefit, it will likely not be a simple matter. It's alarming to me, the hurdles that have been put in front of businesses in this province. And what's more alarming is that the surprises just keep coming. And it keeps coming during a time of this worst public health crisis of all time. Mr. Speaker, I can't imagine what would be next. I would like to offer to the debate a suggestion or two with respect to current funding and the new bills. First, please break down the barriers for small business and get the funding already in place to where it needs to be. I can't stress this enough. Everyone in this place has approved hundreds of millions of dollars to help small businesses, and only 2/3 of those funds have actually made it where they need to go. These last two employment bills have just added to the pressure of small business. As I pointed out earlier, many of them are waiting for funding already and are near the brink, and now they have to deal with another cost. Actually, now two more costs. And second, please make the application process to recover these funds as simple as possible. None of the supports that have been introduced have been simple. Rather, they have been very complex, slow, and tedious application processes that have stalled the much needed help to these hardworking people. Mr. Speaker, please, I hope that we do not continue to invent roadblocks for them to navigate. Please allow these businesses that have survived the honest opportunity to get through what is left of this pandemic. In the end, I'm not naive, and I realize that people perhaps require this time, and most are going to make honest use of these benefits that this bill will provide to the workforce and in an appropriate manner. And certainly it sounds to me like the entire House supports that portion of the bill. We've seen the BC Recovery Benefit promised back in the election of 2020 still not being received by a few residents in the Caribou. We are now almost halfway through May, and still we find ourselves having to advocate for people that were counting on this last Christmas, Mr. Speaker. And I can predict that we'll be back to advocating for new claims to be paid under Bill 13. As I said, nothing has been smooth for these operators or for the residents of this province. We've had the BC Business Recovery Program, which has only one purpose, and that was to help businesses survive. One purpose. And the application process for this and the recovery benefit have been a nightmare. And even some of that has been confirmed by the hardworking staff that have had to administer it. We've had to advocate for businesses that were having near-death experiences to try to receive these funds. And I must admit, as a small business owner myself, the ask from government with respect to information that has been required has been absolutely outrageous. I had one business in my riding that almost did not qualify because they didn't make enough money in 2019, which, by the way, was their first year in business. To be in a time when not only are you hoping for help from this government by way of funding, and at the same time trying to accommodate bills like Bill 13 and others, of course, and trying to maneuver around public health orders, I can't imagine the challenges that these businesses are facing on a daily basis. Mr. Speaker, I can only imagine how businesses will feel about trying to go back to the computer and once again trying to take another kick at the can with respect to trying to get any funds out of this government. But Mr. Speaker, there are simply too many businesses close to the edge to continue to add to their burden. I really hope that the second part of Bill 13 will be made clear as to its intention in the coming debate and would clearly outline how it will affect our small businesses going forward at the beginning of 2022. That it will clearly outline if this is another bill that will ultimately be funded on the backs of these small businesses, or will the government continue to fund this? Small businesses, Mr. Speaker, that create unbelievable amounts of employment, unbelievable amounts of tax income for this province, really need the help. Thank you very much, Honourable Speaker, for the time here today to convey my thoughts on Bill 13.
Thank you, Member. Recognizing the member for Kelowna Mission.
Thank you, Mr. Speaker. I very much appreciate the time today to rise and speak to this bill. I'm going to start off by saying it's usually better late than never, or at least it's about time. But in this particular case, late is too late, and the time is actually almost over. This pandemic has shone a light through every crack of legislation, every weakness that we have in policy, every gap that actually exists within our society. And what we've seen through these cracks is racism, discrimination, eroded rights and freedoms, as well as it's created the largest chasm between the haves and the have-nots that we've ever seen in recorded history. And the history books will go to show this. And in this moment, right now, we're talking about something that's coming 15 months too late. While all of this was happening, while every crack was showing, while every gap was being exposed, where was this government? This pandemic started 15 months ago, and I can tell you in the first 2 weeks of that shutdown, every company that I had access to absolutely went into overdrive with contingency plans, with new budgets, with trying to understand what the ramifications were going to be and how to make it through. And it didn't matter if it was companies, nonprofits, agencies, for-profit, it just didn't matter. Every other entity in this province seemed to take note of what was happening on job sites, in offices, in clinics, in our workspaces, and really took a look at how this pandemic was affecting those corners of our province. And yet this government didn't. This government, the largest influence on society, has remained silent. This government, since it came into a majority, has not done the job of protecting the worker. But I can tell you who has. Businesses. I have just listened to 3 of my colleagues talk about how their small companies protected their workers. And I can say with all earnestness that every single company that I was dealing with protected its workers. So today, I want to celebrate this bill. I really do. I want to be excited that we're going to see this come to fruition. And yet it feels like it's almost too late. And it's so little. If the NDP government was interested in reducing transmission and in keeping BCers safe, well, why not bring the legislation forward back in December? It was apparently on the shelf already, or at least back in March. But in June, today we celebrated that we're almost 50% of the first shot, the first dose of vaccine. How is this in time at all? It's too late. The hope of BC, the hope of every British Columbian, really the hope of the globe, is that we're not going to need this legislation much past July 1st. What did we hear our Prime Minister say? You know, we get to have barbecues this summer and maybe even something else this fall. It'll be great. But meanwhile, what have we endured without sick pay? We've watched as seniors died. We knew it was because of the virus that was being brought into the long-term care facilities. We were being told, the alarm bells were being sounded. We knew that. You know what else happened? Our nurses got sick. Our frontline workers were the heaviest hit in terms of transmission. And the other thing that happened is businesses that were not as successful, the have-nots of the businesses were brought to their knees. And they couldn't put those precautions in place. They couldn't put those supports in place for their workforce. So if we truly wanted to stop the spread, if the NDP government were truly serious about this, well, we would have already had one in place. We would have done that because we know that workplaces are a massive spreader of the virus. Time was our enemy in this situation. And while everyone was acting very quickly and pivoting even faster, we sat. We delayed coming back to this house. We delayed having conversations just like this one. And I want to create that discomfort for all of us because we need to act faster when we are in an emergency situation such as a pandemic. Because those that are in the highest transmission environments and workplaces were the least able to actually afford to be sick or to take time off. And so they did. They did go to work. And they went to work sick. And it might not have been that bad for them. Maybe the virus didn't affect them that much. But the 90-year-old that they were caring for, it did. The surgical ward that they were working within did. Some of those workers would have loved to have been protected, would have loved to have taken off that time. Some of those businesses would have loved to provide that, but they couldn't. They couldn't pay for it. So while these businesses that were struggling and were being brought to their knees, again, we remained silent. And it was only after the budget came out, and it was only after the debate in this House where many from this side stood up exactly where I am today and said, we need to advocate for the worker. Where is sick pay? It was only after our provocations that we have seen this government respond. And I'd like to celebrate that today as democracy that's working. Because I care about things like racism and poverty. And I'm not going to pat myself on the back while watching the largest divide between the haves and the have-nots widen. to the greatest in recorded history. But I'm shocked that this government didn't have a plan and didn't have a way forward. They didn't have it in their budget. They didn't have something on the shelf that they could whip out. They didn't have it in a contingency. So how could they not do the one thing that workers would require during a pandemic, which is sick pay, so that they didn't have to go to work ill? What we did see was this government chastise those that were not able to abide by the rules, chastise those who had to work in many long-term care facilities just to make ends meet, ones that were not able to afford rent and stay at home while they were sick. Businesses that were crippled by workers coming to work and infecting their staff. This government remained silent. And that is why we stood up. That is why this side of the House said, "Where is sick pay?" But this act doesn't even come into force until June 1st. How many will actually even require this still? And I am somewhat concerned by the disingenuity, I think I made up that word, of being told that there's a plan on a shelf, but it can't actually be pulled out until 15 months later. And the Section 2 absolutely alarms me. Because the one thing I believe in wholeheartedly, and it's actually why I believe in every single person that sits around this House and in what they do to represent their communities, regardless of what color they wave, is democracy. I believe in it wholeheartedly. And Section 2 flies in the face of democracy because it gives us little time for debate. Oh wait, none. And no data. And once you have the data on the other side, well, then we won't even be able to analyze it or to debate it inside of this House. This is where democracy happens. This is why we are all elected. And it's here that we choose debate and choose to have conversations like this. And thank goodness we do, because we have sick pay legislation in front of us that we wouldn't have had because it wasn't in the budget. But through debate, we now do. So why can we not debate Section 2 in the fall? It's our duty to those that vote for us. It's our duty to those that elect us. It's our duty to make sure that it's in the best interest of every British Columbian. And it's concerning that this bill hasn't outlined many of the provisions, the regulations, the consultation is going to be done after, and we don't get to see it, and we don't get to know what actually transpired. And it likely won't even be in place until the bill is granted royal assent. Considering that the fact that paid sick leave will probably be the single largest cost to this government in the upcoming year, I don't believe that we have conducted, and I don't believe that government has conducted the appropriate public consultation before tabling this bill. And instead, we're just seeing more work done behind closed doors from a government that's displaying a worrying lack of transparency. There are so many details that aren't in here. From WorkSafe BC reimbursement program, how's that actually going to work, to what is the consultation, and minimum consultation has actually occurred, but what is that? Most of it's going to take place after this bill is law. But it's these same businesses that are going to be on the hook for costs associated with this legislation. It's like we're debating a supply bill without actually having a budget. Wait, I see a pattern. And what if we're on the hook for costs associated with this legislation, even if it's temporarily? But we won't be able to consult. We won't be able to debate. We don't even know what's going to happen until January of 2022. But we're being asked to trust on a government that has not yet earned that trust. So forgive me if I'm being somewhat reticent to give blind approval. But if what this NDP government does with long-term care reports, Site C reports, or COVID-19 data, for instance, or any data, for instance, if it's any indicator of what they're going to do behind closed doors on this bill, on one of the largest labor laws of our time, I am concerned. And I want to be excited. I want to say yes. I want to unequivocally put my name to something of that magnitude. But right now, I'd be putting my name to nothing. I don't even know what I would be saying yes to, because it's not going to be known until January of next year. 3 days of sick pay, it's a start. It's not enough to get someone through COVID. British Columbians deserve this bill. Workers deserve this bill. Businesses deserve this bill. But I'm not sure if it's what they want or need. And they don't deserve it this way. Not without a full democratic process in place on Section 2. The public deserves better. The public deserves transparency. The public deserves debate, because the public deserves democracy. Employers on their knees. Women excluded from the workforce. Racial minorities hardest hit in highest transmission jobs. Youth inordinately affected. And this government wants to add an anti-democratic process to the list of ills affected on this population? Why? We have time. And I believe that this NDP government can do the right thing. The Premier and Labour Minister continue to admit that struggling BC businesses cannot afford additional costs. Yet there's potential for additional costs within this bill. My hope is that you will hear our urges for democracy. And hopefully democracy is something that we can all agree on. Thank you, Mr. Speaker.
Thank you, Member. Recognizing the Government House Leader, Member for Kamloops North Thompson.
Oh, thank you for the promotion, Mr. Speaker.
Opposition House Leader. Sorry, thinking back a few years. Member.
Thank you, Mr. Speaker. It gives me pleasure to rise to Bill 13, the sick pay bill. As we've heard, unfortunately, this is several months long overdue. When you think back to March 23rd last year, when this House unanimously voted on COVID spending package that was unallocated money at the time, billions and billions of dollars, with further votes for even more billions of dollars. And at that time, and as we progressed through COVID, what became very clear was, in spite of us approving unanimously those billions of dollars, the Premier was relying on riding on the coattails of the federal government for programs and supports to help individuals and businesses. The billions of dollars was very hard to track where the government was putting it, where they were spending it, what they were doing with it once it was approved. And that should be of concern with people as they look at Bill 13 moving forward. Because it wasn't that long ago that the Premier said sick pay needs to happen, but it cannot come at the cost to businesses. They can't afford it right now. The Premier couldn't even keep that commitment with this bill, with a $3.1 billion slush fund built into their current budget. With the billions of dollars approved last year by this House There was no excuse to need to wait for the federal government for a sick pay program to be in place that would have had to cost businesses money. They could have simply funded it out of the billions of dollars that were unanimously approved by this House. Money they had trouble spending, money they couldn't get out the door. They still can't get out the door. Their business grant program went from a one-year program that the Premier actually said, you don't understand, that's not how it works. It all has to be spent by March 31st. Lo and behold, the unspent money showed up in this year's budget, and then we suddenly had a 2-year program for business supports. But that money still can't get out the door. So then they had to rob it for circuit breaker money, in spite of a $3.1 billion slush fund, because they don't have any confidence that the remaining money of that program is going to actually be get out the door to businesses, because they've made it so cumbersome and so full of red tape. So we could have had a provincial sick pay program fully funded by the province last year for pandemic reasons. The money was there. The money was approved. The money sat. And instead of people getting the help they needed to stay away from workplaces when they were sick, we saw a second wave, and we are now in the middle of a third wave. And this government has the gall to bring forward a bill that flies directly in the face of what the Premier committed to. And then the Premier wonders why people are done taking him at his word. Because he's demonstrated time and again that his word is worthless. His election promises have been worthless. His commitment to businesses that a sick pay program would not have any cost to those businesses, worthless. When you look at this bill, absolutely, any business with people that earn under $25 an hour, there won't be a cost to the business. That is a large portion of businesses, absolutely. It doesn't help many of the trades-based businesses out there. I guess construction sites aren't quite as big of a worry for this government and this Premier. I guess the tradespeople out there, most of whom, if not all, earn over $25 an hour. I guess those businesses that will now have to shoulder the difference don't count as businesses shouldering a cost to this Premier and this government. So if they're going to play semantics with language like that, imagine why we have apprehension on Section 2, the Just Trust Us clause, because there is no trust. That trust has been shattered time and again by this Premier failing to act and follow through on any of his commitments. His words, his actions do not match up with what he was saying previously on a wide range of issues. You want to talk transparency? That doesn't exist. Certainly doesn't exist in this bill. It took 15 months, Mr. Speaker, to deliver a bill that essentially says businesses will pay the difference and it will cost us roughly $300 million, but we're not really sure because we can't show you any of the data that we use to calculate to get to that number. So either calculations were made, and once again, the government doesn't want to share any of that data on how calculations were made. Sounds a little familiar. Or they just randomly picked a number out of the air that they thought this might cost. So let's say it's $300 million on the tail end of a pandemic. So probably $500–600 million last year for the main part of the pandemic, especially if it was not to put any costs on businesses. Last I checked, March 23rd, we approved $5 billion of open spending for the government last year. Then they came back in December and needed a couple $2 billion more. They got that too. Didn't spend it all. Wouldn't tell us where they were going to spend it all. Wouldn't tell us why they needed $2 billion to push out a program that was going to be about $1.2 or $1.3 billion. Didn't want to tell us where the other $700 million were going. All the while pointing their fingers at Ottawa saying we don't have a pandemic sick pay program because Ottawa won't fund it. Well, this chamber voted enough money for for them to fund it. So they can say all they want that they care for the worker, but it seems very clear that unless Ottawa was going to carry the luggage for them, they weren't going to do anything. We're seeing that with childcare now. We're seeing it with a wide range of issues. Any supports to a direct person or business of any consequence through this pandemic has been because the federal government initiated things, not because this government did. So we have a bill with sick pay, 3 days, that will put costs on a great many businesses out there. A great many. The government can't have it both ways, Mr. Speaker. They can't praise and talk about good paying, family supporting jobs, all of which would be over $25 an hour, and then turn around and introduce a bill that says to that employer paying those people those good paying family supporting jobs that actually you do have an added cost with this bill. Just ignore what the Premier said a couple weeks ago. Apparently, we just need to ignore whatever the Premier says. He either misspeaks or he just changes his mind and doesn't want to be forthright about why he changed his mind. So it makes sense now why last week when we were asking where this bill was and asked direct questions of the Minister and the Premier if they were going to use the $3 billion to fund it, to follow through on the Premier's commitment, his own words, that there would not be an added cost to businesses with a sick pay bill for the pandemic period, they wouldn't answer that question. They wouldn't give a direct answer that, of course, we're going to live up to the Premier's commitment, to the Premier's own words. Instead, it was evasion and tap dance around as we see question after question and question period. And of course, when we point out that our suspicion is that means the bill coming forward will have an added cost to businesses, we get head shakes from the government. Of course it won't. We won't dip into WCP surpluses. We won't change WCB rates to employers to pay for this. Well, at least they didn't do that. But they're still adding a cost to businesses. And if I'm wrong, the minister can correct me in his closing comments that all those tradespeople that earn $25 an hour or more, that there's no added cost to their employer if they need to trigger this sick pay for 3 days. That a gas fitter, a welder, a plumber, an electrician, a framer, the list of jobs, especially in the interior, that are over $25 an hour is never ending. I instantly got an email. People think people don't watch the chamber and care about the debate, according to the Premier. I couldn't believe that today when the Premier pointed out that perhaps parents of kids struggling with addictions don't really care what our debates are around addiction issues. That was offensive in the extreme, frankly, to those families and those parents struggling for help, wanting to know what's going on with their legislators, talking about something as critical as that. People do pay attention. I had emails last night instantly when this bill was brought in, because employers are concerned about the cost to their bottom line. They grudgingly understand the 3 hours of pay to go get a shot because they want to keep their workplace safe. And then they see this layered on. They see this layered on, and the employers I'm hearing from are self-made contracting companies that started 30, 40 years ago as 4-people operations, built themselves up to hundreds of employees. And I know the NDP don't like hearing about the 90s. In the 90s, they were dropped back down to 15, 16 employees. They've built themselves back up to 200. They're based in a small town in my riding. They do work all across the province on large industrial sites. They have 200 employees. Not one of them gets paid even close to $25 an hour. How much is this going to cost them? After hearing the Premier commit to no added cost to businesses. So again, I invite the minister to correct me when he gets up in his closing comments and confirmed that there is no added cost to any employer in this province, including those that pay people good family-supporting jobs over $25 an hour. But he won't be able to do that, which means the Premier's words, once again, are completely hollow. And then we get to Section 2. Section 2, the Just Trust Me clause. Just trust a government that couldn't even be trusted with a $3.1 billion slush fund to follow through on the most minimal commitment possible by the Premier that a sick pay program for the pandemic would not be on the backs of businesses. But still, just trust them moving forward. Why is that clause, is that section so important? Because that's what sets the stage for sick pay moving forward, which most definitely will be on the backs of businesses. But that program, that section and how that will roll out just gets approved with zero detail to it. Now, we've waited 15 months to see a page-and-a-half bill that apparently was so complex it took forever for the government to figure out how to say, well, you get paid 8 hours an hour, up to $200 per employee. God knows when you're going to get paid, because the government takes forever to disperse any money of relief. So you can upfront the money, but that's not a cost to businesses, apparently, for their cash flow. No cost there as they wait months, potentially, to get this money back from the government. But just trust us. Just trust us on what January will look like when the real cost to businesses fully hits, including those businesses that pay employees under $25 an hour. Just wait. Trust us. It'll be fair. So there was no rush for 15 months in the middle of a pandemic to bring something forward. Now we have Section 2 with a big rush to get through the House now that won't even take effect till January 1st, 7 months from now. Newsflash for government, we're supposed to be back in this chamber in October. Last I checked, we could still pass legislation in October. The legislation around sick pay moving forward could be reintroduced in October, passed and well in place long before January 1st. But that would require legislation to be brought forward to this House after proper consultation happened. After proper consultation with stakeholders, with labour groups, with employee groups, with employers who do not have bottomless pockets that this government seems to think they have. That could easily happen. The timeline would be very easy. That would give another 5 or 6 months of consultation by this government to then bring forward what sick pay on January 1, 2022 would actually look like. It would get debated just like this bill is here. A day or two later it would be through. Obviously the government has a majority. They're going to do whatever the heck they want anyways. But they'll go through the guise of consultation, but at least people will know what to expect January 1. But that's not what's going to happen. And frankly, the just trust us line is wearing a little thin for most people. So when the Premier says just trust me, but he can't follow through on a commitment that businesses won't see a cost for pandemic pay of sick days, businesses start to get pretty cynical. Employees actually even start to get pretty cynical. We've heard that from the labour groups. They don't even know what the heck the government wants to do with sick pay. They don't know if it's going to be 7 days for a year, if it's going to be 14 days, if it's going to stay at 3. It's quite remarkable for a government that's supposed to be so tightly aligned to Labour that even Labour is shaking their head and saying this bill doesn't really meet the test of what they were hoping for. At least that would be understandable. We have businesses that aren't really happy with how this is laid out, and we have Labour that's not happy with how it's laid out. Now I know, and especially the Attorney General is fond of saying, well, that would just mean if no one's happy, we must have a proper bill. Well, no, that's not actually how, things work. If you have proper consultation and proper explanation to people, and people actually know where the guideposts are and where the end line is, they may not ultimately like it, but they will at least understand it and move forward with that. Let's look at the justification the government used for the ever-increasing minimum wage, which is fine, but time and again, the government has said businesses need to know how to plan. They need to know what's in store for them. They need to be able to make plans in advance and know what the schedule of the minimum wage increases are. Suddenly, with this bill, with Section 2, they don't need to know that on something as potentially as expensive as sick pay legislation with who knows how many days. But just trust them. It is unbelievable to me when you look at the timelines available to this government to have something properly vetted, properly discussed with the broader community, with the broader business community between now and when we reconvene this chamber in October, to have something in place for January 1, that this is the junk of a bill that we wound up with. It is beyond unbelievable that that's how this government has chosen to deal with things as something as fundamentally important as a change in sick pay legislation in this province. Especially when the first half of the bill very clearly breaks the Premier's own commitment. But just trust the Premier. Just trust the Premier. He's a man of his word. I mean, that's why there's no more portables in Surrey, right? It's been 4 years. Oh, wait a second. There's record numbers of portables in Surrey. Record numbers of portables in Surrey. It was the Premier's words 4 years ago that there'd be no more portables in 4 years. Not my words, the Premier's words. Not my words, Premier's words. Premier's words. There's going to be a cancer centre in Kamloops in 4 years. That was 6 months ago. It's nowhere on the horizon at all. Premier's words, not my words. It was the Premier's words that there would be no cost to businesses for pandemic sick pay. That was his commitment, not ours. We were asking where the legislation was for 15 months. Contrary to what the Premier flung out in question period, we actually wrote a letter in May of 2020 wondering where the sick pay legislation was to the Premier. Didn't get a response. He must have been waiting for Ottawa to try to bail him out. So that seems to be the response. Everyone will have $10 a day childcare. Oh, no, we're going to wait. Oh, look at that. Ottawa threw it in the budget. I guess we can just drag our feet a little bit longer. Premier's words, not our words. Premier's words. Oh, there's going to be a $400 renter subsidy. That sure disappeared fast. But just trust them. Trust them on an open-ended bill that has the potential to add massive costs to every business out there. And it's very deceptive because if you're a business owner right now that doesn't pay someone over $25 an hour, you're probably not paying that close of attention to this bill because you're thinking, well, okay, there's probably going to be, knowing this government, a 9-month or a year delay getting reimbursed, but technically I'll get reimbursed at some point. The problem is this bill, come January 1, will create a sick pay program that employer of restaurants, of those pesky 20 to 39-year-olds that the Premier seems to keep are blowing it for him, all those frontline workers in retail, in transportation, in restaurant and food service areas that don't necessarily make $25 an hour, a great many of them, all those employers who won't necessarily be impacted between now and December 31st, oh, they got a big bill coming for them after December 31st. But we can't even tell them how to budget for that bill because this government has chosen to just say, well, we'll do it with regulation. Don't worry about it. We'll do it in regulation. But when all we hear are labor advocates saying, well, it should be 14 days, not 3. And then you hear other labor advocates saying it should be 7. They're trying to be a little more moderate with it over the year. We don't know where the government's going to land. Is it going to be 10 days? Is it going to be 2 basically working weeks If you're sick, that the employer will be paying you to stay home at 100% at their cost, the way this bill is structured? We don't know. But again, why the rush? It doesn't take effect till January 1st. You could actually bring forward a bill in October that actually spells that all out for everybody. People could see it, they could understand what's going to happen in a few months' time. It would have been after consultation had taken place, which frankly is amazing there hasn't been enough consultation given that they've talked about needing a sick pay bill for 15 months. So I don't know who the heck they've been talking to for the last 15 months, but apparently it wasn't in consultation around proper sick pay legislation. Again, Premier's words a year ago. Oh, he's already got a plan ready to go. It took him 15 months, a year to 15 months to fine-tune the one clause in this bill. That's honestly what it took. That's laughable. At least be forthright with people. You didn't want to have to pay it. You got other pet projects of the billions upon billions of dollars that this House has unanimously approved for COVID supports where you want to shuttle it off to. You have $3.1 billion sitting in a budget right now in this fiscal year, specifically earmarked for COVID supports. If COVID sick pay benefits to people in the middle of a pandemic does not qualify as COVID supports, I don't know what will. So if this is going to cost $300 million this year, why not fully fund it? Why not fully fund it so the Premier could actually be a man of his word and not put the costs to businesses? We've heard a lot of praise about the mining industry in this chamber from both sides of the House over the last few days. Those workers are all over $25 an hour. If this supersedes whatever their collective agreement is, this kicks in, not the collective agreement. If they've already negotiated something better, fair enough. That's the fair collective agreement process. And that's between the employer and the employee, as it should be. But if they haven't, this is an added cost. All of those trades contracting companies out there, this is an added cost. All the mechanics shops out there, this is an added cost. All of what you would consider your stereotypical blue-collar worker, as they like to be termed, this is an added cost. To all of those companies, this bill in its current form. And it makes me shudder to think what the bill coming in January, the regulation, it's not going to be a bill because there will be no debate. There'll be questionable consultation because frankly, it doesn't really matter once this bill gets passed what anyone has to say to the government on their thoughts of what a sick pay program should look like moving forward, because the Premier, through the Minister, will have the power to strictly bring it in by regulation. It can be done on a Friday evening, just slipped into the order and council disclosures that happen. Don't even have to have a press release if you don't want to. Although we know the Premier likes his photo op, so I'm sure that by then he'll want some sort of photo op. Patting himself on the back for adding untold costs on businesses. It's simply not good governance. It's not open and transparent government to any measure. And I find myself saying this a lot in this chamber when I'm speaking to bills like this that are so blatantly hiding what the true agenda of the government is. The government members that used to sit in opposition, be it in Victoria, or I think about half of them used to sit in opposition in Ottawa now, I'm not sure, but there's quite a few former MPs on that side as well, asked themselves when they were in their opposition days what they'd be saying to this. And there's actually a lot of Hansard quotes of things coming in on regulation by various governments, both federally and provincially, about the concerns that the opposition would have about things being done by regulation. But instead, what we have is a bill that is totally open-ended. It provides zero insight at all to where the government is trying to head with future sick pay legislation that will kick in on January 1st. None whatsoever. No data on how they're going to have the matrix on it. No data provided on how they even came up with the $300 million for the existing program that's in this. Nothing. And that is a problem. Because when the Premier stands in front of the media and says there will be no added costs to businesses, and turns around 2 weeks later and has his minister introduce a bill that actually does have a cost to businesses, credibility goes out the door. It's simply not there. It doesn't stand up to a smell test whatsoever. So it'll be interesting as we get to committee stage, listening to the justifications and the tap dancing that will start to happen and the reworking of what the Premier's words really were or not. Because that's what's going to happen. That's what will happen if this comes up tomorrow. Hopefully it does come up tomorrow. I know the other side will howl, oh, we're trying to delay because we spent all of a couple hours talking about a bill today. But I think after waiting 15 months for a bill that's all of a page and a half, that's not unreasonable. So we'll get to committee stage, hopefully tomorrow. Hopefully the government will see fit to bring it forward, because it's been a long time where we've had any substantial legislation to actually discuss in this chamber anyways, after what, we're going on 7 weeks out of 12. But it's good they finally have brought something forward to at least kind of get into. It's too bad that half of it has absolutely no detail for us to actually scrutinize and look at. It's too bad that the other half has no data that the government's willing to share and talk about of how they actually created that first half of the bill. And it's really too bad that yet again we have a prime example of the Premier breaking his word. There's no other way around it. He flat out has broken his word yet again. The trustworthy factor of things that this Premier is now saying at all times in the middle of a pandemic, when people should be able to trust what he says, absolutely, as that is actually what will happen in the middle of a pandemic. It's shocking that this bill so clearly misses that mark. So the minister will have a lot of answers to have to give on behalf of the Premier, as many ministers seem to have to do these days, to clean up the mess of what the Premier has said that doesn't match legislation and doesn't match government actions. But this bill does not come close to fulfilling what the Premier committed to, and it certainly should send shockwaves through the business community moving forward in January, just how open-ended and free it is for the government to do whatever they want with sick pay starting January 1, which will be 100% on the backs of business owners that will still be struggling to come out of this pandemic. Thank you for the time, Mr. Speaker.
Thank you, member. Seeing no further speakers, recognize Minister of Labour to close debate.
Thank you, Honourable Speaker. I want to thank the members who took part in the debate of this very important bill that we're debating. Mr. Speaker, I think the theme from the opposition was that it's a long overdue, and why didn't we act on last year when they wrote a letter? Mr. Speaker, I just want to clarify that one point, that we weren't sitting idly by. When pandemic hit us, we start to get to work immediately. We put support system for businesses. We put support system for families and workers, Mr. Speaker. Since we're talking about workers, let's zero in on the workers, what we did in those 14 months. First, worker didn't have the right in this province to take sick leave without losing their pay, without losing their job. We fixed that. Mr. Speaker, through presumption clause, with the help of WCB, We brought in changes so that the workers who become sick because of COVID-19 at workplaces, they get their benefits from day one, immediately without delay. Otherwise, it takes days and weeks sometimes to process the claims and going back and forth, whether it is a work-related or not. But in some presumption clause fixed that problem. Mr. Speaker, lately, we know that the vaccination program is the one that will take us to the end game of getting over the pandemic. We brought in paid time off for workers to go and get vaccinated. It's good for the businesses, good for the workers, good for the communities where the workers live, Mr. Speaker. But parallel to all of that, we were working with the federal government to bring in a national solution to this national emergency. Their twins in Alberta believed in the same thing. Their cousins in Saskatchewan believed in the same thing. Their guru in Toronto said the same thing. Mr. Speaker, because we all agree it was a national emergency, there needs to be a national solution. That's why our premier took the charge, and the federal government listened. They put in Canada Recovery Sick Benefit Program. Of course, there were flaws and gaps in there. It was brought to their attention by the premier, by myself, by my other colleagues when they were talking to the federal counterparts. Qualifying criteria. You must lose at least 50% of work or income in order to qualify for the federal program. And if you qualify, Mr. Speaker, $500 is less than our minimum wage here. We brought it to their attention, and 2 weeks was not long enough. They listened, they extended that to 4 weeks. So, Mr. Speaker, there was a one gap, that the 1 day or 2 days when the workers lose before they qualify for the federal program is going to be fixed with this bill that we are debating right now. Why today? Mr. Speaker, the federal budget came only 2 weeks ago. Ours was day after. When we tried to convince them, they failed to fix those gaps, Mr. Speaker. Then it was up to us to go on our own, have a BC-made solution to fix those gaps. That's what we are doing with this one. Workers in British Columbia, when they wake up in the morning, they feel sick. They have symptoms. They can stay home, and they can be assured they're taken care of. They would be assured that they will not lose any income as a result of that. And the workplaces are safer because the transmission of COVID is limited now. Mr. Speaker, that's what we are trying to do here. Now, I want to go to the other areas that they brought in. A member from Kelowna Mission, with all due respect, I think that would be a very good leadership speech that I heard. A lot of politics, but it was full of factual errors. She mentioned many of the healthcare workers who went to work sick. She mentioned nurses. She probably should check out that they have sick benefit plans in their collective agreements. Other healthcare workers also have that. The other thing that, Mr. Speaker, she mentioned, the racialized communities, racialized workers, the women who were hurt because we delayed in bringing this. Now, she can be forgiven because she wasn't there. Talk about, neglecting and trampling on racialized and women's rights. But she sit around the caucus table. They have members on that caucus table today, member from Abbotsford West, their current leader. They were the chief architect of the onslaught of attacks on the workers' right in 2002, 2003. 10,000 workers were thrown on the street so that they could bring in their donors and friends to take their jobs. Most of them were racialized workers. Most of them women, immigrants. She could talk to those that were still on the caucus table. Why did you do that? What did we do to fix it? When are we going to apologize to them? She never did that. And then she mentioned that how we are making decisions behind closed doors. Again, she wasn't there. But there are others who are still on the caucus table. When WCB Act was rewritten, when Labor Code was rewritten, when Employment Standard was rewritten, they sent one person, went to his boardroom, rewrote the whole thing. No consultation with nobody. That's what closed-door decisions are, Mr. Speaker. And then the House Leader talked about consultation for the Part 2 of this bill. They don't matter, he said. They don't matter. You know why he believed in that, Mr. Speaker? Because that's exactly how they operate. They make up their mind, then they go for consultation, then they just bring it in what they believed in the first place anyway. Mr. Speaker, our record is very clear. When we brought in changes to the Labor Code, we went around the province. Thousands of input, 29 recommendations, almost unanimously agreed to by the panel. We adopted almost all of them, Mr. Speaker. That's consultation. When we changed the employment standard, again, consultation around the province. We accepted those recommendations. That's exactly how we operate. They don't believe in consultation because they never did. So anyway, Mr. Speaker, those are some of the things that unfortunately came. I think it's a very good bill, and I hope that they could support it because they wanted to have it in. They said they wrote a letter back in May last year. I hope that they will support it. It's a good bill, two parts to it. It'll have an immediate short-term solution so that the worker, if he missed 1 day or 2 days, they will not lose any income. They'll stay home and we'll stop the transmission of workplace. Long-term solution, we will do the consultation. We will be guided by the consultation what kind of long-term solution there need to be. How do we go around and go about it will be determined through consultation. So we are fixing those short-term and long-term solutions, Mr. Speaker. And I think that's all I have to say, but it's a good bill. I hope we get the support because there's so many people out there that are waiting for us to pass this bill so that they could actually utilize it. Good for business, it's good for workers, Mr. Speaker. So proud to talk about this and support this bill, Mr. Speaker. Those are my comments, Mr. Speaker. Now I move second reading of Bill 13.
Members, the question is second reading of Bill 13, the Employment Standards Amendment Act number 2. Those participating remotely should prepare their voting cards. Those in favor indicate aye. Aye. Those opposed indicate nay. The motion is carried. Minister of Labour. Division. Minister of Labour has called division. Pursuant to session order March 1st, 2021, the division will be deferred to 30 minutes prior to the end of today, which for today is 6:30 p.m. Minister. Acting Government House Leader.
Thank you, Honourable Speaker. I call Committee Stage Bill 2, the Public Interest Disclosure Amendment Act 2021.
Thank you very much. We'll take a short recess as we prepare for the committee stage. Call the committee to order on Clause 1 of Bill 2. Abbotsford West. Clause 1. Carried. Clause 2, Abbotsford West.
There, we'll get it done. Okay, on Clause 2, I wonder if I can ask the attorney to, and I think the officials tried to explain this to me when we had the briefing, and I must confess I wasn't entirely clear. I think this is in part, these subsections previously existed in Section 25 of the Act, and that, of course, is being changed. I think actually Section 25 is being deleted in these amendments. But why again is it necessary to particularize specific sections of the Ombudsperson Act and not the other 12 acts referred to in Section 3.2?
Attorney General on Clause 2.
Thank you, Mr. Chair, and thank you to the member for the question. A couple of pieces here. The member is correct that this amendment repeals Section 25 of the existing bill. And Section 25 was in the section that related to investigations under PETA. And the original drafting decision was that it would make sense to harmonize the ombudsperson's powers related to investigations
by incorporating them into the PETA Act in the investigation section. What became apparent was that the Ombudsperson authorities that would be beneficial to have harmonized in PETA and in the Ombudsperson Act weren't limited to investigations. So, for example, the Ombudsperson has an authority to delegate. The Ombudsperson has a privative clause in the Ombudsperson Act that insulates against some forms of judicial review. And so, given the broad nature of some of these powers, not limited to investigations, but that the Ombudsperson was understandably desirous of incorporating into PETA, they were moved to Section 3, the section relating to how PETA relates to other forms of legislation. The specific provisions that have been removed are, in terms of the Ombudsperson's Act, and disapplied, that are the exception to this rule of wanting to incorporate it, all of the Ombudsperson Act's powers into PETA. Section 16 provides protection from reprisals. It duplicates what is already provided in the Act, and so to ensure consistency within the Act itself, the PETA protection from reprisals apply for the purposes of PETA-related disclosures. And similarly, Section 29 of the Ombudsperson Act provides immunity, which is also provided in PETA, so it's been removed as well to ensure consistency within the Act itself. So I hope that assists the member with the question. I received some correspondence I just wanted to put on the record from the Ombudsperson clarifying the member and I had a couple exchanges where I wasn't as clear as I wish I could have been about an investigation that the Ombudsperson's office was engaged in related to PETA. And just to put on the record, the Ombudsperson has written and made it very clear that investigation is not related at all to the Ombudsperson's office. It is related to a different ministry and is conducted, or agency, and is conducted under the Ombudsperson's authority, and is not, there are no active investigations of any type within the Ombudsperson's office. Is something that he wanted to make clear, certainly to my office. Thanks.
Abbotsford West on Clause 2.
Thanks. I'm obliged to the Attorney General. I think you'll be able to tell from his correspondence that I received a similar, I suspect a very similar type letter, and I think it's appropriate for him to relay to the committee the submission from the Ombudsperson making clear what the attorney has just said, and for the purposes of laying any concerns to rest within the Ombudsperson's office. I too have received that correspondence and am satisfied with the information, making clear that the investigation the attorney and I were discussing yesterday did not relate to allegations about matters that may or may not have occurred within the Ombudsperson's office. So I'm glad we've cleared that up, apparently to the satisfaction of all. Last thing on Section 2, that phrase in the bill, subsection 3, with necessary modifications, language in statutes tends to be pretty specific. That's strikes me as a bit vague. Is there an example that the staff can assist the attorney with as to what that might refer to with the phrase "with necessary modifications"?
Attorney General.
Thank you, Mr. Chair. I'm advised by staff this is a classic mutatis mutandis provision. I'm sure I don't need to say any more to the member, and that should be fully explanatory. But just in case for others listening at home, and I did have to look it up to confirm my understanding, that the idea is that the ombudsperson, and of this Latin phrase, that the ombudsperson, the main points of the section that are incorporated still apply, but can be altered to be appropriate for the bill that it's being incorporated into. So the example that was offered to me was Section 9 related to confidentiality. In the Ombudsperson's Act, there are no exemptions for disclosure related to PETA. Of course not, because it was drafted and put in place before PETA. And so for the confidentiality requirements about non-disclosure in Section 9 of the Ombudsperson Act, those would be interpreted through this phrase with necessary modifications to incorporate the exemptions to non-disclosure that are contained in the PETA Act in order to make it fit within the context of the bill. So the confidentiality requirements and authorities apply from the Ombudsperson Act, but because they're brought into PETA, they should be read in the context of the bill and the exemptions, for example, in this case, that apply to confidentiality. I hope that assists the member in understanding that phrase with necessary modifications.
Abbotsford West.
Mr. Speaker, Mr. Chair, I'm going to ask that we go to Clause 9.
On Clause 9.
Thanks, Honourable Chair. I just want to confirm with the attorney. I believe the amendment to Section 10 of the main statute contemplated by Section 9 of the bill, or Clause 9 of the bill, relates to the addition of 4 sub A, and again the receiving a request for advice. I think that's the case, and the attorney can probably confirm that quickly. And then perhaps he could also confirm that under both the statute and in practice, a senior official can be designated by the chief executive to do 1, 2, or 3 perform 1, 2, or 3 of these functions, or can be appointed to perform all 3 of these functions. I think we canvassed that somewhat in another section, but we'll just confirm that here.
Attorney General.
Thank you, Mr. Chair. I can confirm for the member that with respect to the addition of 4 sub A, the section was always intended to apply to disclosures and requests for advice, but not complaints about reprisals, because designated officers don't handle those. But the term request for advice is being added to give explicit reference so that it's clear for organizations and employees about the role of different senior officials. And the member is correct in his assumption that you could have one separate senior official doing each of these functions, or one single senior official doing all 3. That discretion of how to divide or not divide these authorities is up to the organization.
Shall Clause 9 pass? Aye. Shall Clause 10? Aye. Abbotsford West on Clause 10.
Thanks, Honourable Chair. We don't have enough time to have the fascinating conversation I contemplated having on Section 10, and it is by no means the single biggest point to be made in legislative history. But it's curious, so Section 11 is going to be amended by this to ensure that an employee who is considering making a disclosure may request advice, but we've now chosen we're going to add may request and receive. Is that a little bit of legislative overkill? If you may request something, presumably you are entitled to receive it, but perhaps not.
Attorney General.
I'm advised this is the noble motivation of the drafters to be as clear as possible about the relevant authorities.
Shall Clause 10 pass? Shall Clause 11 pass? Shall Clause 12 pass? Abbotsford West and Clause 12.
And I thank you, Honourable Chair, and I neglected to include this in the list I gave the attorney. I apologize for that. My question, and this is around the anonymous seeking of advice, and I suppose this crops up in where a disclosure is making a disclosure as well on an anonymous basis. But I guess the practical issue here is if I can seek advice without identifying myself, how does the designated officer know they are dealing with an actual employee?
Attorney General.
Thank you, Mr. Chair. So the idea here is to err on the side of receiving information about wrongdoings. There is certainly a risk of somebody posing as a provincial employee. However, the thinking is that it would be relatively easy to figure out if someone was providing information and had access to information, knowledge of a particular ministry or agency that would reveal whether or not they were such an employee. But in any event, if the information was useful to the ombudsperson and did in fact disclose information of a concerning nature that would, where there would be a desire to do an investigation, that the ombudsperson would not be foreclosed simply because it came in anonymously from conducting that investigation. And it does provide the authority where there's some concern, perhaps, that the anonymous disclosure may not have the status that they claim, that the ombudsperson's office has the authority not to notify that person of what they are doing with that information. It provides a discretion under subsection 2.
Abbotsford West on Clause 12.
Thanks, Honourable Chair. I take it from the attorney's answer then there's a recognition that there is a risk, but the belief is that it is a manageable risk and that there are sufficient safeguards to preclude a situation from a mischievous situation from arising or being carried too far. Is that a fair synopsis of what the attorney has said?
Attorney.
Thank you, Mr. Chair. I think that's right, and that the benefits of allowing anonymous disclosure outweigh the risks of a system where you would have to identify yourself to the ombudsperson before providing a disclosure.
Shall Clause 12 pass? Carried. Shall Clause 13 pass? Abbotsford West on 13.
I alluded to this, Honourable Chair, yesterday, and we had a conversation about what the receiving information designated officer can do in circumstances where there is a belief that there's an imminent risk of danger to life, health, or safety. I won't read the whole clause. We went through that. What I found curious is it's permissive in that it says the designated officer may report the information to a protection official. And I thought in the circumstances described in the legislation, wouldn't it ordinarily follow that they must, having hit the threshold spoken to about having come to the conclusion that there is a danger to life, health, or safety of persons, wouldn't it follow that the permissiveness would give way to a directive verb, which is you must report that?
Attorney General, on Clause 13 and noting the hour.
Thank you, Mr. Chair. I am advised that there are two issues at play here. One is it may be that there is countervailing concern that might cause the ombudsperson or other authority to feel that disclosure was not appropriate in the circumstances. Without knowing that in advance, this discretion allows for that weighting exercise to take place. But more likely and far more realistically is the fact that mandatory provision would be basically unenforceable. The only entity that was aware of the information would be the ombudsperson. So there's no way to review or oversee the failure to report adequately, and no mechanism for that. I'll just note that this section came about at the request of the ombudsperson as a result of a lacuna that office observed in their authorities to identify and proactively address these issues. So while it's an interesting legislative discussion, happily I don't think it will likely be a significant real-life issue.
Noting the hour, please.
Noting the hour, Honourable Speaker, I move the committee rise report progress. And we could wrap up. Well, Honourable Chair, seek your leave to move sections 14 through 26.
You're looking at me? Shall Clause 13 pass? Carried. Shall Clause 14 to 25 pass? Shall the title pass? Minister.
Thank you. Much prefer to move this one, Honourable Chair. I move the committee rise and report the bill complete without amendment.
Members, vote is about to take place, and those participating remotely, please prepare your voting cards. Yeah. Okay. My error, I forgot commencement. Shall Clause 26 commencement pass? Aye. Carried. Minister.
Thank you, Honourable Chair. I move the committee rise and report the bill complete without amendment.
Thank you. So, once again, for those of you participating remotely, please have your cards ready. The question is, the committee rise report the bill complete without amendment. Those in favor say aye. Aye. Those opposed? Nay. Motion's carried.
Committee Chair.
Committee rises on Bill 2, reports the bill complete without amendment.
When shall the bill be read third time? Minister.
Now, Honourable Speaker.
Members, the question is the third reading of the bill. All those are participating remotely, have your cards ready. All those in favor indicate aye. Aye. Those who oppose indicate nay. Motion carried. Bill number 2, Public Interest Disclosure Amendment Act 2021, and has been read a third time and has passed. Members, pursuant to sessional order, a deferred division will take place shortly on the motion for second reading of Bill number 13, Employment Standards Amendment Act number 2, 2021. I would like to remind members participating remotely that they must now enable their video. And pursuant to sessional order, the House stands at recess for 10 minutes. Members, I call the House back to order. The division will proceed in 5 minutes. Members, please make sure those who are participating remotely have your videos turned on. We will now proceed with the deferred division. The question is second reading of Bill number 13, Employment Standards Amendment Act number 2, 2021. The clerk will now conduct a roll call division in alphabetical order by caucus, beginning with the government caucus. Members, please clearly state I vote aye or I vote nay when your name is called by the clerk. And I also would like to remind members participating remotely that they must unmute their microphone when their name is called by the clerk. The voting cards cannot be used for formal division calls. Madam Clerk.
Mike Farnworth.
I vote aye.
Pam Alexis.
I vote aye.
Brittany Anderson.
I vote aye.
Michelle Babchuk.
I vote aye.
Brenda Bailey.
I vote aye.
Harry Baines.
I vote aye.
Lisa Bear.
I vote aye.
Gary Begg.
I vote aye.
Jagrup Brar.
I vote aye.
Spencer Chandra Herbert.
I vote aye.
Susie Chant.
I vote aye.
Katrina Chen.
I vote aye.
George Chow.
I vote aye.
Dan Coulter.
I vote aye.
Mitzi Dean.
I vote aye.
Bob Deeth.
I vote aye.
Adrian Dix.
I vote aye.
Finn Donnelly.
I vote aye.
Megan Dykman.
I vote aye.
David Eby.
I vote aye.
Mabel Elmore.
I vote aye.
Rick Glumack.
I vote aye.
George Heyman.
I vote aye.
Ravi Kalon.
I vote aye.
Ann Kang.
I vote aye.
Rana Ray Leonard.
I vote aye.
Grace Lohr.
I vote aye.
Bowen Ma.
I vote aye.
Sheila Malcolmson.
I vote aye.
Melanie Mark.
I vote aye.
Andrew Mercier.
I vote aye.
Josie Osborne.
I vote aye.
Kelly Padden.
I vote aye.
Lana Popham.
I vote aye.
Bruce Ralston.
I vote aye.
Murray Rankin.
I vote aye.
Jennifer Rice.
I vote aye.
Selena Robinson.
I vote aye.
Janet Routledge.
I vote aye.
Doug Routley.
I vote aye.
Rolly Russell.
I vote aye.
Harwinder Sandhu.
I vote aye.
Nikki Sharma.
I vote aye.
Nicholas Simons.
Vote aye.
Aman Singh.
I vote aye.
Rashna Singh.
I vote aye.
Mike Starchuk.
I vote aye.
Adam Walker.
I vote aye.
Jennifer Whiteside.
I vote aye.
Henry Yao.
I vote aye.
Peter Milabar.
I vote aye.
Dan Ashton.
I vote aye.
Bruce Banman.
I vote aye.
Mike Bernier.
I vote aye.
Shirley Bond.
I vote aye.
Stephanie Kajua.
I vote aye.
Doug Klovchuk.
I vote aye.
Michael DeYoung.
I vote aye.
Lauren Dirksen.
I vote aye.
Trevor Halford.
I vote aye.
Corinne Kirkpatrick.
Vote aye.
Greg Kylo.
I vote aye.
Michael Lee.
I vote aye.
Norm Letnick,
I vote aye.
Renee Merrifield,
I vote aye.
Mike Morris,
I vote aye.
Corley Oakes,
I vote aye.
Ian Payton,
I vote aye.
Ellis Ross,
I vote aye.
John Rustad,
I vote aye.
Tom Shapitka,
I vote aye.
Ben Stewart,
I vote aye.
Todd Stone,
I vote aye.
Jordan Sturdy,
I vote aye.
Jackie Taggart,
I vote aye.
Teresa Watt,
I vote aye.
Andrew Wilkinson,
I vote aye.
Sonia Furstenau,
I vote aye.
Adam Olson.
I vote aye.
Madam Clerk.
Nemine contra descende.
The motion is carried. Minister of Labor.
Mr. Speaker, I move that the bill be committed to a committee of the whole House to be considered at the next sitting of the House after today.
Members, you heard the motion. All those who are participating remotely now can use your voting cards. All those in favor indicate aye. Aye. Those who oppose indicate nay. Motion carried. Committee Chair.
Mr. Speaker, the Committee of Supply, Section A, reports resolution and completion of the estimates of the Ministry of Advanced Education and Skills Training and asks leave to sit again.
When shall the committee sit again, Government House Leader?
Next sitting.
So ordered. Government House Leader.
Thank you, Honorable Speaker. I move the House to now adjourn.
Members, you heard the motion. All those in favor indicate aye. Those who oppose indicate nay. Motion carried. This House stands adjourned until 10 a.m. tomorrow morning.